its successor agency meeting of January 26, 2021 to order. I will ask the clerk to please call the roll.
Thank you, Chair Fletcher. Before I call the roll, I would like to note for the record that all 5 supervisors are participating via teleconference. As such, all votes will be handled by a roll call vote. Additionally, before we begin, any members of the public that wish to provide oral testimony during today's meeting, please review the instructions posted on the Clerk of the Board's webpage. I'll remind members of the public that have requested to speak to wait to dial into the meeting until the item is called. With that, I'll now call the roll. Supervisor Anderson?
Here.
Supervisor Lawson-Remer? Supervisor Desmond?
Here.
Vice Chair Vargas?
Here.
Chair Fletcher?
Here. With that, we will move to the invocation and pledge. If everyone will please stand, we will begin with the invocation, followed immediately thereafter by the pledge. We're pleased this morning to welcome the Very Reverend Penny Bridges of St. Paul's Episcopal Cathedral, followed by the Pledge of Allegiance. Penny, we will turn it to you for our invocation.
Thank you. Good morning, Chairman Fletcher, Vice Chair Vargas, supervisors, and fellow citizens. I bring you warm greetings from St. Paul's Episcopal Cathedral and the assurance of our prayers for the challenging work that you have before you. We step into this holy instant, aware of the brokenness of our world and our nation, full of hope that this new year brings, full of grief for all the loss that surrounds us, full of gratitude for those who serve others. We step into your presence, O Holy One, bringing with us our confusion, our anxiety, and our longing for peace and justice. We give thanks for the abundance of resources, both natural and human, that we enjoy in this nation, and especially in San Diego County. We give thanks for the diversity that enriches our life in community and brings creativity and different perspectives to government. We give thanks for the freedom to govern ourselves, to worship as we see fit, to think and speak without fear of censorship. We give thanks for those whom we place in positions of public trust and who dare to make decisions on our behalf. And we give thanks for the vaccines that give us hope that we will soon defeat the COVID-19 virus that has dominated our lives for the past year. We acknowledge the limits of our humanity before you, Holy One, knowing that each of us can make only a tiny impression on history, but confident that together, in community, with careful listening, with generous hearts, and with courage, we can make a difference for our neighbors. We are a people of endless hope, of endless potential, and endless energy. In the words of our Vice President, even in dark times, we not only dream, we do. We not only see what has been, we see what can be. Holy One, as this Board of Supervisors gathers today to do the work of the people, we ask you to bless and challenge them to do their work with vision, integrity, fairness, courage, open hearts and open minds, seeking the good of all and not the advantage of a few. Give them a spirit of wisdom and understanding, that they may administer justice impartially and enact laws for the welfare of all people, leading us all to a more healthy, just, and peaceful society. We ask this in your holy name, and let the people say, Amen.
Thank you so much. We will now move on to the pledge. I ask you to please stand and salute the flag and join in together. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We will now move to the presentation of proclamations. We have 4 of these which will be given today. The first proclamation I am pleased to present is honoring Adolfo Gonzalez, and accepting this proclamation will be Chief Gonzalez. After almost 5 years of service to the County of San Diego as Chief Probation Officer, Adolfo Gonzalez has accepted the role of Chief Probation Officer in Los Angeles County. This will be his last week with us here in San Diego. In addition to his current position, Adolfo has worked for the San Diego Police Department, the National City Police Department, the FBI, and the District Attorney's Office. In his current role as Chief of Probation, Adolfo has established community-based alternatives to detention with holistic and integrated community service providers for both youth and adult probationers. He's also expanded training and development for probation staff, leading to more trauma-informed system of care. Adolfo has led the probation department through transformative change in our probation services, including adopting the youth in custody practice model, separating the department into two distinct operations focused on adult and youth services, investing in diversion and community-based services, achieving a significant drop in the number of youth in custody. More recently, during COVID-19, Adolfo has demonstrated flexibility with hundreds of early release inmates from state prison, impacts to work furlough and the Community Transition Center, and he's led a probation team who have reacted quickly to serve their clients while protecting public safety and health. Adolfo's dedication and commitment to putting the community first and collaborating with community leaders will continue to ensure and will have a lasting impact on the safety of our neighborhoods and the thriving of those that will extend long beyond his tenure with the county. His 40 years of serving the San Diego County community leaves behind a legacy that will influence the next generation of county probation, and we are grateful for his service and wish him all of the best as he transitions to Los Angeles. So therefore, it is my distinct privilege as chair, along with the entire San Diego County Board of Supervisors, on this 26th day of January 2021 to declare this day to be Adolfo Gonzalez Day throughout San Diego County. Thank you, Chief. Congratulations on your new role, and we would like to turn it to you for a few remarks.
Thank you, Chairman Fletcher, members of the board. It is an honor and a privilege to receive this recognition. I accept this proclamation on behalf of the dedicated and hardworking men and women of the San Diego County Probation Department. Thanks to the excellent relationship we have established with our community, our providers, and our law enforcement justice partners, we have really transformed the juvenile justice system as well as probation here in San Diego County in a collaborative and supportive fashion. Again, I want to thank the CAO, Helen Roberts-Myers, for soliciting me to come over to probation when I was in the district attorney's office about 8 years ago when I started here in the county. And it was a great decision to ask me to step in to be the chief probation officer for San Diego. I want to thank everyone for your support, your commitment, and continued success to the county, to the probation department, and to our next chief probation officer. Thank you, sir.
Thank you, Chief, and good best of luck in Los Angeles. Our next resolution in recognition today is a dear friend and someone who is a tremendous asset to our community. In a little bit at 9:30. Hey, Chief, why don't you mute your phone for us? Thank you. In a few moments at 9:30, we have a time certain hearing of an important item. It's a part of our framework for the future of San Diego around saving lives and improving health outcomes through comprehensive harm reduction approaches. And for far too long in San Diego County, progress in this realm has faced obstacles because of stigma, because of outdated ways of thinking, and because of a lack of a willingness to lean into difficult issues when embracing the clear public health data about the undeniable effective nature of syringe service programs. But on the front lines for many, many, many years has been Tara Stamos-Busick. She is an advocate. She is an educator. She is founder of a nonprofit harm reduction coalition of San Diego On Point. She uses her life experience, her passion, and her deep understanding of evidence-based harm reduction strategies to support and improve the quality of life for individuals who are suffering from addiction, individuals who are stigmatized in a serious way, and for far too long, individuals who did not have access to the most effective ways to save their lives and facilitate treatment. In her work in the Harm Reduction Coalition of San Diego, Tara works to educate community members and navigate and work through to help get the care they need, including preventive abuse treatment, substance abuse treatment, syringe service access, overdose prevention, HIV and HCV testing. As a social worker with a background in substance use treatment and case management, she works with community-based organizations to provide so many important and vital services to those individuals out there who count on all of us to give them a better path out and an opportunity. Throughout the last year, Tara has operated a mobile syringe service program she created. Since October 2020, her program has enrolled over 500 new participants. And The naloxone provided by her program has reversed 129 overdoses. By meeting people where they are, by embracing them as humans, the Harm Reduction Coalition of San Diego and its team not only provides empathy and compassion and dignity, but it is the most effective way to actually enroll people in treatment and help them turn their lives around. Tara sits on various boards and committees locally at the state and national level and is a published presenter. It is my privilege and honor to welcome Tara today to join us and to declare this day to be Tara Stamos Busig Day throughout San Diego County. The advocates and allies on the front lines out fighting the issues, I don't believe get enough credit for driving the consideration of policy changes, and I certainly greatly appreciate Tara and all she has done and will continue to do for San Diego County. And with that, would like to turn it over to her.
Good morning, everybody, and thank you very much, Nathan. On behalf of a population who doesn't get to be represented very often, I would like to say thank you on behalf of the people I have enrolled who have yet to be enrolled, on behalf of the folks whose lives have been lost to overdose and the other collaborative stuff that goes along with that. So the Harm Reduction Coalition of San Diego On Point, we provide harm reduction services, and they do range from syringe service to overdose prevention, risk reduction. We do trainings in the community, and we are comprised of members, including healthcare providers. We have mental health clinicians, substance use counselors. We have members of the community at large, but most importantly, our organization is made up of consumers of our harm reduction services. Our program, it is crucial for our organization to include the consumers of our program in our decision-making process. It's needs-based driven services. And we do accept that abstinence from drugs is not necessarily realistic for everybody. And behind the substance use, that trauma, criminalization, the war on drugs, stigma, broken and lacking systems, connection, and other issues are all behind that drive substance use. And those are issues that need to be addressed while we keep our people safe. And our goal in providing syringe service programs in San Diego is to meet people where they are and be able to address all of those things that keep people from accessing services. And it is a tremendous honor. And this is 20 years in the making. And as somebody with lived experience, I am honored to be at this table. And I'm here to say that the programs that are in existence today are the programs that have saved a lot of lives. And I look forward to the expansion of that in the middle of all the epidemics. So thank you very much. It's an honor.
Thank you. Thank you very much. And thank you for all that you do. The next proclamation will be presented by Vice Chair Nora Vargas, honoring Fred Korematsu. Accepting this proclamation will be La Mesa Councilmember Jack Hsu. Supervisor Vargas.
Yes, thank you, Chair Fletcher. I am proud to present this proclamation in honor of Fred Korematsu, a civil rights activist born and raised here in California. Accepting this recognition, the proclamation is La Mesa City Councilmember Jack Hsu, and I thank you for being here, and Fred Korematsu's daughter, Dr. Karen Korematsu. At our last Board of Supervisors meeting, we collectively proclaimed racism as a public health crisis in San Diego County. Racism is real, and to the extent that we can end prejudice, discrimination, and malice against others is not just worthy or noble. It's something we must make happen, and it's something Fred Korematsu spent much of his life working for. Fred Korematsu was born in Oakland, California on January 30th, 1919. His parents immigrated to this country from Japan in 1905, and unfortunately encounter racism from an early age. When Fred was in high school, a U.S. Army recruiting officer told him that they have orders not to accept you. While they continued to recruit Fred's non-Japanese friends into serving our country, he was subsequently rejected by the U.S. Navy on the basis of his Japanese heritage. Following the attack on Pearl Harbor, companies refused to hire him, and 5 months later, Japanese Americans were ordered to report to assembly centers before eventually being removed to internment camps. Korematsu refused, fled but was arrested and charged by military police. He and his family were placed in an internment camp in Utah. Fred Korematsu appealed his arrest, conviction, and internment all the way to the U.S. Supreme Court, who upheld his conviction on a 6-3 vote. He dedicated much of his life fighting racism and documenting inequities experienced by Japanese Americans following World War II. It wasn't until 1983 when the U.S. District Court formally vacated the conviction. In 1998, President Clinton awarded him the Presidential Medal of Freedom, our country's highest civilian honor. In 2010, our state legislature passed the bill establishing Fred Korematsu Day on January 30th in perpetuity. And I want to acknowledge my colleagues, Chair Fletcher and Supervisor Anderson, who served in the assembly at the time and both voted in support of that bill. Fred Korematsu dedicated much of his life challenging our nation's conscience on racism. Before he passed away in 2005, he addressed racial profiling with these words: "No one should ever be looked away simply because they share the same race, ethnicity, or religion as a spy or terrorist." If that principle was not learned from the internment camps of Japanese Americans, and these are very dangerous times for our democracy. Let us honor Fred Korematsu's memory and legacy today and every day moving forward as we fight for equality, equity, and civil liberties for all Americans, no matter their race, creed, or color. Now I'd like to turn it over to La Mesa City Council Member Jack Hsu, who will then introduce Fred Korematsu's daughter, Dr. Karen Korematsu.
Good morning. Thank you, County Supervisors. Thank you, Supervisor Vargas, for that great presentation. A few months ago, when I thought about what our communities needed during this time of stress and so many things happening, I thought of Fred Korematsu and Fred Korematsu Day of Civil Liberties and the Constitution as a vehicle for us to learn a bit about history, but more importantly, to take us into deep, serious conversations about what our communities need to do with regards to racism, government policies, and government actions. I'm happy to say that in our region, National City had a similar proclamation. The mayor of San Diego signed one last week, and the city of San Diego's City Council will be considering one next week. And my city, La Mesa, will have its proclamation addressed or ratified this evening. So I'm really happy that this is happening. I also want to point out the One Book, One San Diego book for this year is very important. It deals with George Takei's experience as a 5-year-old in a camp. And the children's book for One Book, One San Diego is a loving story about a librarian, Write to Me, as she gave postcards to children leaving to concentration camps, the internment camps during World War II. Both of these books are really wonderful books that I hope our communities embrace and have read. So next I want to turn it over to Dr. Karen Korematsu from the Korematsu Institute.
Good morning. Thank you, Vice Chair Vargas, and thank you also, San Diego Board of Supervisors, for honoring my father today and recognizing Fred Korematsu Day of Civil Liberties and the Constitution on January 30th, which was his birthday. This is the 10th anniversary of this day, and it's especially significant now because it emphasizes our civil liberties and the Constitution. Obviously, what we have seen in Washington, D.C. on the Capitol on January 6th was an attack on our democracy. And we need to remind everyone that our civil liberties and our Constitution are strong, and we need to learn about our rights as American citizens. Also, the governor will declare it Fred Korematsu Day as by law on January 30th, and our California Superintendent of Public Instruction, Tony Thurmond, will also encourage teachers and students to learn about my father's fight for justice and what it means really to be an American citizen. Learning our American history promotes civic education and civic participation. So I thank all of you in the City Council for your work, because that's how we make a difference. We start at our communities, in our districts, and take care of those challenges that we all have, especially today. Also, I want to explain a misrepresentation of my father's Supreme Court case, Korematsu versus the United States of 1944. There have been many people that, including, unfortunately, judicial representation that have misquoted or misrepresented my father's case. At that time, of course, in history, Japanese Americans on the West Coast, 120,000, 2/3 American citizens, were forcibly removed from their homes, stripped of their possessions, put in concentration camps in this country, and had to endure inhuman conditions. This is not the same as having an order to wear masks or to stay at home for your own protection, your family's protection, your communities, and this country. That is not a violation of civil rights. And I want to be sure that people, especially of those that are elected officials, understand the difference, because you are also held responsible for your own communities. We all have rights, certainly, as American citizens, but we need to know those and to understand them legally. This is we live by the rule of law, and we all want to, of course, move ahead on getting out of this terrible COVID-19 situation, but we need to do it together. So as my father would say, remember to stand up for what is right and don't be afraid to speak up. Thank you.
Thank you. Thank you all for those powerful words. The next proclamation will be given by Supervisor Jim Desmond, honoring Rose Schindler and International Holocaust Remembrance Day. Accepting this proclamation will be Rose Schindler. Supervisor Desmond.
Thank you very much, Mr. Chair. Today, I am pleased to honor the International Holocaust Remembrance Day and Rose Schindler, a Holocaust survivor. The United Nations General Assembly has designated tomorrow, January 27th, as International Holocaust Remembrance Day. It's a day we honor the 6 million Jewish victims of the Holocaust and millions of other victims of Nazism, and to develop educational programs to help prevent future genocides. The date marks the liberation of the Auschwitz-Birkenau and is meant to honor the victims of Nazism. Rose Schindler is a Holocaust survivor and an educator who has been one of San Diego's most dedicated memory keepers, sharing her first-person accounts of Nazi atrocities with anyone who wants to hear it. In 2019, she made close to 100 appearances sharing her story with schools, churches, and service clubs. Rose met her husband, Max Schindler, after the war, and they were together for almost 70 years. They raised 4 children before he passed away in 2017. Rose and her late husband, Max, with Lee Connolly, wrote a memoir titled "Two Who Survived, Keeping Hope Alive While Surviving the Holocaust." It's published by her son, Benjamin Schindler, and that shares their stories and experiences. And the County of San Diego, we're committed to recognizing and honoring those individuals who are dedicated to the best ideals of public service. And Rose Schindler is one such worthy individual. So now today, all the members of the San Diego County Board of Supervisors commend Rose Schindler for her outstanding service, leadership, and educational commitment to county residents, and do hereby declare this day to be Rose Schindler Day throughout San Diego County. Rose, if you'd like to say a few words in your honor, we'd love to hear from you now.
Okay, now.
Good morning, everybody.
Morning, Rose.
Good morning. I don't know if you can see me, but I thank you so much for this wonderful introduction, okay? I couldn't have done a better job. So tomorrow is going to be 76 years of liberation of Auschwitz. I'm an Auschwitz survivor. And I also have 2 sisters who are with me. Unfortunately, they're gone by now. So I don't know what else you'd like, how much time I have to tell anything I should, but I've been speaking at schools for the past over 50 years, mostly started at middle school, and I'm speaking to all kinds of organizations, telling the world what happened to us. And I hope this never happens again to anybody, because nobody has a right to do anything what they did to us. So I don't know what else you'd like me to say. Huh?
Thank you, Rose. And
remember one thing, just never give up hope. Remember, tomorrow is going to be a better day.
Thank you, Rose.
Thank you, Jim.
Thank you very much.
Thank you, Rose. Thank you, Supervisor Desmond, for that. We have a time certain item at 9:30, agenda item 13. So we were going to, I know we have a number of requests for non-agendized public comment, and we want to get all of those and get all of those together. So I think what we will do quickly is the approval of minutes of the statement of proceedings, and then we will take up our item 13 at 9:30, and then we will resume the agenda in the normal order, returning to non-agendized public comment and then working through the rest. So with that, we will take up the approval of the minutes statement of proceedings for the meetings of the Board of Supervisors organizational meeting of January 5th, 2021, and the regular Board of Supervisors meetings of January 12th, 2021. Is there a motion and a second?
So moved. So moved.
Thank you. We have a motion by Supervisor Anderson.
Second, Desmond.
And a second by Supervisor Desmond. I will ask the clerk to call the roll.
Thank you, Chair Fletcher. Supervisor Anderson?
Aye.
Supervisor Lawson-Remer?
Aye.
Supervisor Desmond?
Aye.
Vice Chair Vargas?
Aye.
Chair Fletcher?
Fletcher, aye.
That motion passes unanimously with all supervisors being present and voting aye.
All right, thank you for that. We will go to our time certain item, agenda item 13, which we will take up, and then we will return to the rest of the agenda in normal order. Agenda item 13 brings before us a comprehensive approach, part of the framework for the future around saving lives and improving health outcomes through comprehensive harm reduction services. I believe we have an obligation to take actions that we know will save lives, actions we know will improve public health, actions we know will help facilitate getting people into drug treatment programs, and actions we know will have a positive fiscal impact on our county in terms of increasing the ability to draw down, in particular, state funding to help administer these life-saving programs. As outlined in agenda item 13, harm reduction interventions, including syringe service programs, do all of these things. And while some people may not like the optics or may still adhere to many of the stigmas associated, we cannot pass by the opportunity to connect people to critical drug treatment programs and other linkages to healthcare services to protect not only these individuals, but also the broader public health. We have an obligation to do what we know works. In 1997, the Board of Supervisors voted to oppose the establishment of any syringe service programs in San Diego County. The board back then took the action that in 1997 they believed to be best, but now more than 2 decades later, the evidence could not be more clear that syringe service programs are a medically supported best practice that protect public health, save lives, and put people with substance use disorders on a path to recovery. Today, syringe service programs are recognized not only by the state of California, but nationally by the U.S. Centers for Disease Control and Prevention as a vital component, a foundational part of any comprehensive harm reduction strategy. Last year in March, I brought a measure forward to overturn this outdated policy, but at the time the board was not ready to take that step, instead creating an ad hoc committee to do a needs assessment and identify operational guidelines of how a program would be worked. That committee has been meeting, and today you will hear from individuals that served on the ad hoc committee. They will share the decades of research that is the basis for the recommendation we are bringing forward today to incorporate syringe services and harm reduction efforts into our continuum of care of behavioral health services throughout San Diego County. And we will first hear from them, the members of the ad hoc committee. Joining us first is Dr. Christian Ramers, Chief of Population Health for Family Health Centers of San Diego. Dr. Ramers has been a leader on this issue. In addition to all of the work that we've done together around harm reduction, has also been a critical and vital link in our community in the response to COVID-19. And Dr. Ramers, we appreciate all of your work and all of the time you've been able to carve out on this important issue. And I would like to turn the floor over to you as one of the members of the ad hoc committee for your presentation.
Chair Fletcher, Dr. Ramos has not joined the Zoom meeting yet. We do have Lisa and Tara, who are both on the meeting at this time.
Well, let's jump to Lisa Asmus with San Diego State University Institute for Public Health, and then we will go to Tara and then Dr. Ramos.
Good morning, Chair Fletcher and members of the board. My name is Lisa Asmus, and I am here today to present to you findings of a recent environmental assessment of people who inject drugs in San Diego County. This assessment was conducted through a joint effort between the Institute for Public Health at San Diego State University and Family Health Centers of San Diego. The project was funded by the County of San Diego Public Health Services Department, who contracted with us to conduct this assessment. The goal of this assessment was to understand the population of persons who inject drugs in San Diego County, including their attitudes, concerns, and needs. What you see here is a picture of the report, and I invite you all to read this report, clocking in at a mere 280 pages. We learned, and will discuss in more detail, that individuals who inject drugs are vulnerable to a number of comorbidities, including hepatitis C and HIV. We also learned that this is a hard to reach population that faces a great deal of stigma and other barriers to care. Lastly, we found that harm reduction approaches such as syringe service programs can effectively engage this population in order to reduce comorbidities. This population is at increased risk of mortality and many health and social problems, including hepatitis C and HIV, abscesses, mental health conditions, and poverty. In a UCSD study of approximately 600 people who inject drugs in San Diego County a few years ago, 66% tested positive for hepatitis C and 9% tested positive for HIV. According to UCSD experts, this high hepatitis C prevalence means that both medical interventions and harm reduction activities will be needed to eliminate hepatitis C in San Diego County. The same can be said for HIV. This population also experiences extensive barriers to care. Syringe exchange and other harm reduction programs can reduce these barriers by providing services in judgment-free, convenient locations. Please read more about these barriers and how to address them in the assessment report. As shown in this slide, injection drug use of both opioids and other substances is a serious and growing problem in San Diego County. Total accidental methadone, opioid, and fentanyl overdose death rates per 100,000 residents have all increased steadily over the past 10 years. This trend is continuing. Preliminary data from the Medical Examiner's Office indicates a 48% increase in total annual overdose deaths in 2020 compared to 2019. This slide cycles through the years, showing the accidental overdose death rate in different areas of San Diego County, with darker areas indicating a higher death rate. We are seeing an increased trend over time, and it is evident that substance use disorder services are needed throughout the entire county. At the time of this report, only one syringe service program in San Diego County operated within the limits of San Diego during limited times. There is now a second exchange in San Diego. However, I am sure that Tara will agree that demand for services still far exceeds the supply. Harm reduction provides us with a solution to the consequences of injection drug use in San Diego County. Harm reduction refers to policies, programs, and practices that aim to minimize health, social, and economic consequences of substance use. It encompasses a spectrum of strategies ranging from safer use to abstinence from drug use, and importantly, includes the tenet of reducing health consequences and disease transmission among people who are not abstinent, as well as those who are abstinent. On the next slide, I will talk a little more about syringe service programs, which are an effective method for engaging the population and providing the services listed. Syringe service programs are easily accessible community-based prevention programs that serve the population of people who inject drugs. They are extensively studied, evidence-based, and being promoted by the California Department of Public Health. They function as a gateway to other services for this marginalized population, and as such have been shown to reduce fatal overdoses, reduce risky injection behaviors, facilitate entry into drug treatment programs, increase the use of health and social services, decrease the rates of hepatitis C and HIV transmission, and reduce publicly discarded injection litter. In response to the request to develop operational recommendations, our report outlines 5 key recommendations. Improve organizational planning. Specifically, create a coordinated focus within existing initiatives to oversee the implementation and effectiveness of interventions for people who inject. Create professional networks that can foster continuing education to guide strategic planning efforts. Number 2, utilize and strengthen harm reduction approaches. Specifically, adopt and strengthen harm reduction approaches among programs and agencies, rather than approaches that may alienate or disqualify persons who inject or are not abstinent. Increase the number of staff trained and retrained in harm reduction. Number 3, expand services and education. Expand syringe exchange services and access to syringes through pharmacies. Consider developing safe injection sites. Integrate services for people who inject in one location. Syringe exchange along with primary medical care, substance use services, mental health services, etc. Expand low barrier medical care, especially for services such as hepatitis C treatment, and PrEP, which is a pill you can take to prevent HIV infection. Mobile medical services would be ideal. Increase overdose prevention awareness among the population. Improve awareness of and low barrier access to substance use disorder treatment and medication-assisted treatment programs. Address housing and other basic needs to ensure the success of the interventions. Number 4, reduce stigma from the community and professionals. Launch public awareness campaigns about the impacts of addiction, challenges to overcome addiction, benefits of harm reduction, and common myths regarding harm reduction services. Educate professionals about the population and the stigma or trauma they experience, especially homelessness. Provide education and support for law enforcement. Number 5, educate and empower people who inject. Internalized stigma and shame among this population creates barriers to the receipt of and successful outcomes from services. Work with mental health experts to design outreach and educational efforts. Educate people who use drugs and the community about disease risk, overdose prevention, and available resources. Teach and support this population to advocate for their needs and navigate the healthcare system. This concludes our report back on the environmental assessment findings. At this point, we will take any questions.
Thank you, Lisa. I think what we'll do, we'll get through, I think Dr. Raymer is on. I know he has other appointments. We'll hear from Dr. Raymer, and then Tara, and then I think we'll go to public comment, and then after that, we'll go to board deliberation, and there are very likely to be questions from fellow board members. Christian, thank you for joining us. We appreciate your work on this, and I would like to turn the floor over to you now.
Thank you, Chair Fletcher. Can I have my slide deck up, please? Great. So my name is Christian Ramers. I'm one of the assistant medical directors at Family Health Centers and wear a bunch of other hats. But I think for this presentation, most relevant is that I'm board certified as specialist in addiction medicine and infectious diseases. And what we're talking about with syringe exchange is really a tool that helps address both of the problems with those large areas. Next slide, please. So the term syndemic, I think, is very relevant here. We can't oversimplify what it means to offer syringe exchange services. We are dealing with poverty, mental health, substance abuse, and infectious diseases in a population that is relatively difficult to treat and relatively difficult to think of interventions that can help these individuals and get them out of their cycles of addiction. Next slide, please. Just to give a quantity of how many people we're talking about here, I'm one of the co-chairs of the Eliminate Hepatitis C San Diego initiative. And as part of that exercise, we underwent a database process led by Natasha Martin, who you'll hear from later this morning, talking about COVID. But she and other researchers at UCSD were able to estimate the number of cases that we have of hepatitis C in people who inject drugs to be about 17,000. Amongst all the cases of hep C in the county, about 55,000. So this is an enormous problem, hepatitis C alone. And if we're going to get to elimination, we need to acknowledge this fact that people who inject drugs are a key population. Next slide. Just a little bit further, data that was brought by this exercise done by Dr. Martin. The general population has a lot of hepatitis C as well, 32,000 cases on the far right there. Men who have sex with men is another key population. And then, as Lisa has just mentioned, people who inject drugs have the highest percentage of seroprevalence, about 65%, accounting for 17,000 cases in San Diego. Next slide, please. So we look at data on overdose as another public health crisis here. And this panel here is actually from 2018. And that blue panel on the top, you can see the rate of overdose death, 268 per 100,000. Sorry, 7.4 per 100,000. If you go forward one more slide, you can see we're moving backwards. We're not making any progress here. We're actually seeing more overdoses. More people, more of our young San Diegans are dying from overdose deaths. This is absolutely a crisis nationally that's been made worse by COVID. If you go to the next slide, I think Lisa already walked you through the animation here. We can probably step through it very quickly just to get to the 2019. She stole my thunder there with the overdose deaths throughout San Diego. The point here is that this is happening all over our county, particularly in the east and the north of our county, where we have hotspots of overdose deaths. And you can see the numbers from 2018, 268 people, almost one every day, dying from overdose deaths due to opioids. And go to the next slide. Again, we're not making any progress here. This number has gone up. In 2019, almost one San Diegan died every single day of an opioid overdose. And you can see the breakdown there between prescription opioids, heroin, synthetic opioids, and really clogging up our emergency departments with, for all those that die, there's probably 10 more that had an overdose reversed by Narcan in the right hands. Next slide. So I want to talk a little bit about what syringe service programs are. You'll notice that it's not just called needle exchange. The term syringe service program is a relevant one because there's a whole lot more that happens than just exchanging needles. Next slide. So what do we do? Family Health Centers has been running a syringe service program for many years now. Here's a list of all the services that are offered. We collect and dispose of contaminated needles. There's distribution of fresh needles that can prevent infectious diseases. We allow harm reduction kits or allot harm reduction kits. We do HIV and hepatitis C testing and linkage to care. We refer to primary care, mental health, and very importantly, refer to substance abuse services. And we distribute naloxone to save people's lives. I'm happy to say that tonight, starting at 6 p.m., I will be staffing the very first hepatitis C treatment van paired to our syringe exchange to make further impact on that population and hopefully eliminate hepatitis C. Next slide, please. Just to walk you through the numbers, people say, well, you're just distributing needles that are going to end up on my sidewalks. Well, actually, the opposite is true. We are taking in more needles than we distribute. This is the data cut that was done last year, showing, if we could go to the next slide, the number of syringes in and the number of syringes out listed by Family Health Centers programs. So we've taken in 500,000 syringes that are now disposed of properly rather than being on our streets. Per session, we take in an average of 241 needles, again, that could be on our beaches or our streets. And then this was just a data cut, again, from last year. showing that we've distributed over 3,000 naloxone kits to help reverse overdose and keep our San Diegans alive. And there have been 354, I'm sure this is close to 500 by now, since the data has advanced a little bit. And on site, we have reversed 8 overdoses. That's 8 lives that have been saved just by this program alone. Next slide, please. So you probably have questions. The supervisor certainly did last year when we talked about this. Does the program decrease transmission of HIV and hepatitis C? Does it result in increased drug use? What about the cost effectiveness? And then who is really behind this? Is this some kind of left-wing fringe group that's promoting this? And hopefully in the next 5 minutes, I'll answer all of these questions. Next slide. In scientific and biomedical research, we look for the highest quality of evidence in something that's called a meta-analysis. A meta-analysis is a collection of all the literature in a particular area to look for the general net effect of something. And a 2017 meta-analysis found that by looking at 28 different studies of syringe service programs, looking at both opioid substitution therapy, which is Suboxone or treatment for drug addiction, as well as needle exchange. And this incorporated almost 9,000 person years of follow-up, so very, very robust data. Next slide, please. And the net effect is that the opioid substitution therapy reduces hepatitis C transmission by 50%, and when you combine that with needle exchange, it reduces hepatitis C by 74%. There's very little that we do in medicine that actually reaches that level of effectiveness. Thank you. Next slide. This study is looking at drug use. This is a study done by my colleagues at the King County Public Health Entity in Seattle, and they studied almost 3,000 people who inject drugs over 3 years. Next slide. And the general finding is that people who are participants were almost 3-fold more likely to report decreases in their drug injection behaviors, 3.5-fold more likely to stop injecting altogether, and 5-fold more likely to enter drug treatment programs. So this is probably the most important thing I'm going to tell you today. And it's hard for a lot of people to get their heads around because they think syringe exchanges are just peddling drugs and making drug use more common. The opposite is true. Syringe exchange programs or syringe service programs are designed to give people an off-road from a highway of chaotic drug use that they can't get off of. How are you going to gauge this population, get them into treatment if you don't meet them where they are and give them an opportunity to seek care when they're ready? And this evidence supports that. Next slide. In terms of cost effectiveness, I just think about this in terms of every new HIV infection that we can prevent. HIV is a lifelong disease. It costs about $15,000 a year in drug costs only that the taxpayers are paying for to treat HIV. And if you can prevent one case, it saves literally hundreds of thousands of dollars over the lifetime of that person. This is a 10-year study of programs in Australia showing that HIV was reduced by up to 70% and hepatitis C by up to 43%. Next slide. And overall, we're talking millions of dollars of healthcare costs that can be saved, hundreds of millions of dollars, I should say, in terms of the lifetime that you would have to treat that person who had HIV or hepatitis C. Next slide. And the next slide. So as I said, who's endorsing this? I'm going to go from the globe down into California here, but next slide, please. WHO is very clear about what the #1 priority is in terms of harm reduction, needle and syringe programs, paired with a whole lot of other things to be a comprehensive package. But if you don't have needle and syringe programs, you can't even really get started in terms of harm reduction. Next slide. Our own CDC has actually been very consistent about this and has not wavered, saying that nearly 30 years of research has shown that comprehensive syringe service programs are safe, effective, and cost-saving, do not increase illegal drug use or crime, and play an important role in reducing the transmission of viral hepatitis, HIV, and other infections. Next slide, please. California Department of Public Health has come out with legal positions and all kinds of white papers saying that this is the right thing to do and strongly supports syringe service programs in the local health jurisdictions, and in fact actually has tied funding to the presence or absence of syringe service programs. Next slide. And the former HHS Secretary Alex Azar also got squarely behind syringe service programs in terms of endorsing them. I'm sorry, I'm covering up the other article here, but it was actually 2016 that the federal ban on syringe service programs was lifted, and that effort was spearheaded by 2 senators from West Virginia, Mitch McConnell and Shelley Moore Capito. Next slide, please. Finally, we do have a national strategy to eliminate hepatitis C, and right high up on the priority list there is to expand access to syringe exchange and opioid agonist therapy. We are just never going to get to elimination of hepatitis B or C in our country if we don't have this as a key strategy. Next slide. So I'm going to finish here, and hopefully I've answered these questions that you might have. Do the syringe service programs decrease transmission? I think this is obvious. It's about 75% when combined with a comprehensive approach using opioid substitution therapy as well. Do they result in increased drug use? This is the hardest for people to understand, but they do not. I would not be doing this as a medical practitioner trying to get people into addiction treatment if it didn't work and if it didn't have robust evidence supporting it. I showed you just one slice of that from the group in Seattle, King County, but we're talking about a 3 to 5-fold higher likelihood amongst those that participate in needle and syringe programs in terms of getting into addiction treatment. Are they cost effective? The limited evidence to date says yes. Just think about how much it costs to take care of one new HIV infection or one new hepatitis C infection. And finally, who's endorsing this approach? Pretty much everybody, almost everybody. Any serious public health authority, whether it be the WHO, the California Department of Public Health, or the CDC, or the National Academy of Sciences, has really gotten behind this as an evidence-based approach. I think that's all my time, and I'll yield the floor.
Thank you. Thank you, Dr. Ramers and Lisa, for both of those incredibly comprehensive walks through just a fraction of the total data and science that's out there developed over many decades to show how it saves lives, saves cost, and is in the public interest. Last presentation today, and then we'll go to public comment and then pick up board deliberation, is from Tara Stamos-Busik, who we heard from earlier, someone out on the front lines actually administering and running these programs. Tara, thank you for joining us. We will turn it to you now.
Thank you. Good morning. I don't have slides this morning. I don't have a bunch of data to talk about, but what I do have is the real life experiences of the individuals that we are impacting on a daily basis. Each time that we go out and do services, we are meeting with at least 30 individuals on a daily basis, where they are on the sidewalks and such. And I hear from them on a regular basis that we are the ones that remind them that they matter, that we are the ones that they trust to get them into treatment. We build relationships during a very vulnerable 2-minute interaction where individuals are talking about their drug use. They're talking about the things they do around their drug use. They're talking about their sexual partners. They're talking about all of the things. They don't have to lie. They're not feeling stigmatized. And so we build relationships with individuals in a very quick way, and we're able to meet them with brief interventions and the best possible services for each individual. And we are finding that we are sending a number of people into treatment programs that they're being successful in. Just in 3 months, that an overdose number, since I gave it to you, has increased almost by 30, and 30 more overdoses that have been reported in the last, reversed in the last week and a half. And then we added almost another 100 participants to our list, and we are finding that people are not being able to access services even more during COVID. And so we're really looking forward to the board lifting the ban on these programs, so that not only myself and Family Health Centers, but other organizations and the county itself can support and be open to the funding that's available. I myself am funded through the California Harm Reduction Initiative grant. I wrote and received a grant for almost a little over $400,000 that runs the program that we're able to deliver to the individuals in San Diego. I know that when I look at all of the data that I have, it costs 8 cents to give out a syringe to each individual, and separate from all the other supplies that I give, I might spend an average of 80 cents to $1.40 on a person in one day on syringes. And those costs are extremely low compared to the cost of any kind of healthcare, wound care, hepatitis C. And I wouldn't be here today if it wasn't for syringe service programs. And it's the compassion, the empathy, the ability to see people in their most vulnerable spot. And if we can't help people in this predicament, and people who are living with chaotic substance use, if not us, then who? And if not now, then when? And I really like, Christian, your statement about this being an off-ramp, and harm reduction really is that off-ramp. And we're here to catch people when they're ready to get off that off-ramp and to guide them into services that will best meet their needs so that we can address the overdose crisis, the epidemics of HIV, hepatitis, and STDs along with COVID, and really build connection and compassion as we move forward. Thank you.
Thank you. Thank you, Tara. I'll ask the clerk if there's any requests for public comment on item 13.
Thank you, Mr. Chair. Yes, we have 9 requests to speak on this item. Any members of the public that have requested to speak, please dial into the conference line now using the instructions that were provided to you. Also note for the record that we received 34 e-comments on this item. We will be calling speakers by the last 4 digits of their phone number. You'll hear a notification that your call has been unmuted. You will then need to press *6 to unmute your phone. Each caller will be asked to state their name for the audio record, and you will have 3 minutes to address the board. You'll hear this sound when your time is up, so please conclude your comments at that time. I'd remind the public speakers that they should mute their TV or live video stream before they begin speaking. Aaron, if you could please identify the first caller.
Yes, our first caller is 0290.
Hi, my name is Rain Hankey-Ledwith. I'm a constituent of Supervisor Fletcher's district. I'm calling in support of San Diego adopting more comprehensive harm reduction approaches. We're the 8th largest city in the country. I think it is so important that we catch up to the times and increase that level of care and connection. As we've seen during COVID, we are so interconnected in so many ways, and we cannot keep pushing drug users to the margins. They can't be ignored, and we need to reduce the stigma in this county and increase the amount of points of access for care, and that's ultimately going to bring us to a healthier society. So thank you so much.
Thank you. Our next speaker is 2943. 2943.
All right. Thank you, everyone, for taking the time to discuss this issue. My name is Jen LaBarbera. I'm the Education and Advocacy Manager for San Diego Pride. And as one of the region's largest LGBTQ organizations, we're voicing our support for this approach that will make a significant impact on the health and safety of LGBTQ people in San Diego County. LGBTQ people are disproportionately impacted by addiction. An estimated 20 to 30% of the LGBTQ community abuses substances, compared to just about 9% of the population as a whole. In addition, while HIV transmission traced to intravenous drug use has decreased over the years, it still does account for about 9% of new infections annually across the nation. We also know, of course, that these rates of disproportionate impact are exponentially higher for Black, Indigenous, and people of color. We as a county have acknowledged racism as a public health crisis, and this health issue is no exception. As you heard from the presenters, here in San Diego, we do have amazing organizations and services on the ground that are already pursuing some of these harm reduction strategies, including some really excellent, explicitly LGBTQ affirming recovery resources and services. But all of these community-based organizations and direct services cannot tackle this issue on their own. They need support, and I'm hopeful that our County Board of Supervisors will offer support and assistance to these existing organizations and really invest in this new syringe services strategy and harm reduction approach. So in conclusion, in order to best support and protect the health and lives of LGBTQ folks in San Diego County, San Diego Pride does strongly support lifting this old ban on these approaches and implementing this new syringe services strategy and harm reduction approach. And I hope that you, as supervisors, will also invest in supporting all people struggling with addiction and recovery, including our LGBTQ neighbors and residents, by developing data-driven, compassion-based, and reliable harm reduction interventions that we know actually work to help improve health outcomes and save lives. Thank you so much.
Thank you. Our next speaker is 9481. 9481.
Hi, my name is Luis Montero Adams, pronouns he, him, his, and on behalf of the San Diego LGBT Community Center, I'm calling today to urge the Board of Supervisors to approve item 13. As a community health organization working to end the transmission of HIV, we are proud to support this item. In order to end the HIV epidemic, we need all of our tools available to us, including syringe services programs. SSPs are a medically proven strategy with over 30 years of academic research to demonstrate their effectiveness. And the center strongly supports the implementation of an SSP as part of a broader harm reduction strategy. Thanks for your time, and we hope we can count on your adoption of this item.
Thank you. Our next speaker is 4592. 4592. And if we don't hear from you when your phone number is called, we will come back to you. Our next speaker is 4592. 4592, you need to press *6 to unmute yourself.
Thank you. Good morning, Chair and fellow supervisors. I have supported evidence and science-based drug policies for 20 years and recognize when a wolf has been cloaked in fine clothing. Of course, no progress has been made to prevent increased drug abuse or overdose. A needle exchange program is not a framework for a future, at least not a positive one, or one any parent wants for their children. Policies such as this support and enable those struggling in abuse and addiction to continue living a life focused on their drug of choice instead of their futures. These programs are reactive, expensive, inferior, and uninspired. They do not improve health outcomes as claimed. They ignore best practice of preventing drug abuse in the first place, and supporting brief screenings and interventions in medical settings. Screenings and brief interventions offer a comprehensive, integrated public health approach that delivers early intervention and treatment services to people with or at risk of developing substance use problems before their problems progress too far. Preventing drug initiation and addiction is the most cost-effective and sustainable drug policy. It enhances human productivity, health, and success rather than draining healthcare, law enforcement, criminal justice, and treatment resources. Addiction industries don't profit from prevention, and bureaucracies are not sustained by them. When preventing drug abuse is ignored on behalf of for-profit industries and bureaucracies, it is clear who these electives have chosen to serve. Thank you.
And could you please state your name for the record?
Oh, it's Kathleen Lippett.
Thank you. Our next speaker is 8546. 8546.
Good morning, Chair Fletcher and members of the board. My name is Nick Galino, and I'm calling in support of expanding harm reduction in San Diego County. I'm a native San Diegan and the CEO and founder of Recover, which is a local outpatient harm reduction treatment program that's working to improve treatment outcomes and reduce overdoses. I'm also a graduate of a Last Chance High School up in North County, where I went on to work for 5 years during the height of the opioid epidemic. I have as much cause as anyone to dislike drugs and their effects. I've lost friends, I've lost family members, and I've lost students to heroin overdoses, and I'll likely lose more before this year is over. I'm here to tell you that one of the best things you can do for these people is support harm reduction efforts in San Diego County. The data are clear. Harm reduction works. It reduces disease and saves lives and is cost effective. As mentioned earlier by Dr. Rommers, studies show syringe exchange programs can reduce HIV prevalence and save thousands of dollars per year per case prevented. Additionally, case studies show that access to quality harm reduction treatment can reduce overdoses by almost 80%, which would have saved over 250 lives in San Diego County in the last year for which data are available. Simply put, harm reduction helps keep people safe while they try to get well. Addiction is a chronic, progressive disease. We do not only treat cancer patients who are in remission, and we should afford our most vulnerable that same level of care. As one of your constituents, I entreat you, please save lives, help people, and support harm reduction. Thank you.
Thank you. Our next speaker is 3800. 3800.
Thank you for letting me speak. It's Barbara Gordon. The proposed lifting a ban on needle exchange program and developing a strategy to reduce harm for syringe users is a concern to me. San Diego has a needle exchange program and the number of deaths continue to rise. The priority should be focused more on treatment programs for anyone addicted to drugs if you really want to save lives and improve health outcomes. There are real health concerns to a community that needs to be considered when having a needle exchange program. The negative consequences to such a program will more likely increase the number of addicts coming into a community, promote more drug use as it lowers the perception of risk of injection drug use, especially with our young people. Again, I am concerned about this needle exchange program in the county. Thank you.
Thank you. Our next speaker is 1306. 1306.
Good morning, everyone. My name is Eric Rothwell-Yuan, and I'm the Legislative Director for the San Diego Psychiatric Society, representing over 375 psychiatric physicians in San Diego and Imperial counties. We strongly support this measure and would note that the American Psychiatric Association has been in support of safe syringe and other harm reduction programs for over 10 years, finding that these programs do not increase or incentivize substance use, but instead decrease transmission of HIV and hepatitis and open a window into treatment for psychiatric and substance use disorders. I echo some of the previous speakers who discussed how overdose-related deaths have increased nationwide during COVID-19. So we're encouraged to see San Diego looking to follow evidence-based public health measures during the pandemic. We are willing to be of assistance in this important step for the health of all San Diego communities. Thank you.
Thank you. And that concludes public testimony on this item. Chair Fletcher.
Thank you. We will go into board deliberation. I want to thank all of those who weighed in. We have the opportunity in front of us to adopt what is the most effective treatment program that there is, 5 times more likely to enter treatment because of comprehensive harm reduction strategies. We have the opportunity to vote on a thing that will decrease the number of dirty and infected needles out there, will save lives. And I want to point out for the last 2 decades, we have missed out on significant state funding because we have not adopted a best practice and we have not been in a position to draw down these available funds. And so with that, I'll put a motion on the table to adopt the recommendations in agenda item 13. 1, find any prior board direction opposing harm reduction programs, including the 1997 resolution, no longer in effect. 2, create a plan to realize a syringe service program that meets the needs of San Diego County as demonstrated in the research study and other evidence presented in today by the board ad hoc committee. And 3, return in 90 days with a comprehensive substance use harm reduction strategy. We know these programs can save lives and help attack the growing epidemic of addiction in our community. The evidence could not be more clear, and the time is now. So with that, I will make a motion. I will ask if there's a second for that motion and if there's any board member comments.
I would like to second that motion.
Thank you. We have a second. We will go to Supervisor Lawson-Remer, followed by Supervisor Anderson.
Yes, I just want to thank the vision and the leadership for bringing this forward. This is obviously a critical crisis that's been facing our community for too long. And this approach aligns very well with the overall orientation we're taking on the board and in this county towards evidence-based policymaking, where we're looking at best practices and looking what really works to serve our community and trying to adopt those kinds of measures and scale them to benefit the communities here in San Diego. So I'm really grateful of the vision here and to begin this, to reorient towards an evidence-based approach across all of our programs, starting with harm reduction. Thank you.
Thank you, Supervisor. We'll now go to Supervisor Anderson.
Is it possible for us to move forward with a motion that would allow seeking the funds to pursue this and come up with the exact plan? I'm not opposed to this, but I'm concerned about changing board policy before we see what the final product looks like. I'm not comfortable voting and then later learning that all the clinics are going to be located in my district. And I know I'm saying that bluntly, but I feel more comfortable if I knew where the clinics would go, how it was implemented. I understand that there's been success with this, but without seeing where it's all going to be located, it's very difficult for me to vote for this. I'm not saying I wouldn't vote for it after I see the plan, but before seeing the plan, and I get that we have to pass and tell staff to pursue putting the plan together, and they can't put the plan together until we give them the approval to put the plan together. But is there some middle ground? Because I hate to vote no against this if it turns out to be a wonderful thing, but I don't want to vote blindly.
No, I understand, Supervisor Anderson, and I think the actual plan will come back in 90 days. But in order to have them develop the policy, we have to remove the prohibition on developing the policy, and so we're in a little bit of a bind here. You will have an opportunity in 90 days to review the plan, and then you could support it at that point. If you desired, and I think your concerns are fair. I think your district's certainly the hardest hit by these issues. You and Supervisor Desmond, and so I don't think that they would all go there. But I'm very pleased we have a number of these programs that are existing that already exist and operate in my district and have been for decades, and that's why we have so much research and how successful they've been. But we do have to repeal the 1997 policy as a statement of approach in order to develop the comprehensive plan. But you will have a chance in 90 days to again, have this plan come back, and you can have some input and engagement between now and then. And so if you aren't able to support it today, you will have another opportunity in 90 days to consider that when you see the actual harm reduction strategies in place.
Well, I'm not going to be supporting it today. However, that doesn't mean I won't support it down the road. I just need to see the implementation prior to voting in favor of it. Thank you for that clarification.
Fair enough. Thank you, Supervisor. Supervisor Vargas?
Thank you, Supervisor Fletcher, for bringing this board letter forward for consideration. I actually think that specifically the pandemic has created bigger issues when it comes to substance abuse in many of our communities. And so I fully support and believe that it's worth exploring the syringe program. And this is a way for us to really help reduce the number of transmissions of infectious diseases in our county. And so with that, I think the analysis that was put together indicated that among the top priorities for individuals that are substance abuse users includes housing. And so this shows to me that we need to take a comprehensive approach with our services to make a significant impact in assisting our populations. And so I will be voting in support and appreciate this opportunity to do so.
Thank you, Supervisor Vargas. Now go to Supervisor Desmond.
Thank you, Mr. Chair. Appreciate it. I have a question concerning, I guess, your recommendation number 3, where it said, come back within 90 days for actions that broaden the existing opioid and drug and prescription drug misuse strategy to bring a harm reduction approach to all substance use and interventions across the county. And I'm asking the question because I still, giving out needles still has the appearance of promoting drug abuse. And with the, fourfold increase of drug overdoses since COVID began, I don't think that the needle exchange is the best thing we want to put forward. But I would like to see more prevention towards drug abuse itself. And so, to me, we're kind of treating the symptom instead of the cause. It's the cause of drug abuse and people, overdosing and dying of it 4 times the rate they were before. So I'm just wondering, is this 90-day that's going to come back only going to be concerning the harm reduction of needle exchanges, or is it going to also include additional intervention and preventions for just drug use overall? I'm not really clear what this is.
I think, Supervisor, I think we all agree getting someone to not start using these drugs is a positive step. And I think we have a lot of those strategies in place, but a comprehensive harm reduction strategy is comprehensive, which includes both prevention and when individuals do start, how do we most effectively get them into treatment? And so a comprehensive harm reduction strategy, which is what we want to bring back, includes both prevention and treatment. And I think you have to do both. You have to do prevention, but you also have to have the most effective forms of treatment. for individuals who have started. And so it would include both.
Well, I understand. I'm more on the prevention portion, and then once they're on the treatment's okay. But I don't know. I would like to see more emphasis on prevention in the first place of treating people before they get to the point of using needles. And to me, I'm sort of in the same boat here with Supervisor Anderson on this item. I see that drug or the needle exchanges are help promote health among those that are using, and most of the people then that get the needle exchanges have a better chance of going into programs and things like that. But I think we're kind of treating the symptom instead of the cause with this item. So thank you very much.
Thank you. Okay, with that, we have a motion by myself, a second by, go back to Supervisor Anderson.
Is it, when they come back with the plan, is it possible to ask them to also include hepatitis outbreak? Because I think that looking at where hepatitis has shown up in San Diego County would help us focus where those clinics would be most useful as far as addressing the hepatitis issue. Thank you.
Yeah, no, we could include that, and certainly outbreaks of hepatitis are directly tied to a lack of syringe service. Without a doubt, the tremendous positive health impacts that happen on the spread of hepatitis by having a comprehensive harm reduction strategies, and I think that is an appropriate thing to be included in the clinic when it comes back. So, all right, with that, we have a motion by myself, a second by Vice Chair Vargas to adopt the recommendations in agenda item 13. Before I ask the clerk to call the roll, I just want to take a moment to thank the medical professionals, the drug treatment specialists, the individuals who dedicate their life to helping individuals deal with addiction and avoid that, who have spent the last 2 decades fighting tirelessly to change an outdated policy and to move this board in a position to adopt something that we know will save lives, will facilitate treatment, will advance public health, and will be right by the taxpayers. And so for all of you out there, I'm eternally grateful for your efforts. You brought us to this moment. And with that, I would ask the clerk to call the roll.
Thank you. Supervisor Anderson?
No at this time.
Supervisor Lawson-Remer?
Oh, aye. Support.
Supervisor Desmond?
No.
Vice Chair Vargas?
Yes.
Chair Fletcher?
Fletcher, aye.
That motion passes with Supervisor Anderson and Supervisor Desmond voting no, all other supervisors being present and voting aye.
Thank you very much. We will now resume our normal agenda flow. We'll return to non-agendized public communication. This is an opportunity for members of the public to address the Board of Supervisors on subject matters within the board's jurisdiction, but items that are not on today's agenda. The only action the board may take is a referral to the Chief Administrative Officer. Reminder, according to Rule 4A, members of the public that are non-English speaking and need interpretation assistance will get twice the allotted time for their comments to allow for the facilitation of interpretation. Mr. Clerk, do we have requests for non-agendized public comment today?
Thank you, Chair Fletcher. We have 14 requests to speak on matters not listed on the agenda this morning. Any members of the public that have requested to speak during non-agenda public communication, please dial into the conference line now using the instructions that were provided to you. As a reminder for the callers, if you requested to speak on a specific agenda item, please hang up and call back when the board begins discussion of the item. We'll be calling speakers by the last 4 digits of their phone number. You'll hear notification that your call has been unmuted. You will then need to press *6 to unmute your phone. Each caller will be asked to state their name for the audio record. You'll have 2 minutes to address the board. You'll hear this sound when your time is up, so please conclude your comments at that time. I'd remind the public speakers that they should mute their TV or live video stream before they begin speaking. Aaron, if you could please identify the first caller.
Yes, our first caller is 9832. 9832.
Good morning, members of the Board of Supervisors. My name is Jennifer Alonzo, and I'm a licensed mental health clinician at the San Diego Central Jail. I've been an employee here for about 2 years. I'm also a proud SEIU Local 221 union member. I'm calling today in solidarity with my nursing and mental health colleagues to tell you how much the nursing staff here in the jails are being affected by the mandatory overtime still being implemented by the Sheriff's Department. The nurses, who are the true heroes of this pandemic, are still being forced to work three shifts of overtime instead of 2, which was previously mandated, which for some is truly impossible. The mandatory overtime is exhausting and it's inhumane, leaving our workers at risk for injury and potentially deadly mistakes. The staff shortage has been going on for too long, with empty promises from administrations of help. Before the pandemic, our nurses were so understaffed that admin promised 30 more nurses. That never came to fruition. Nurses have been continued to be forced to work these horrible hours with no plan of relief, which causes more and more of our nurses to leave their jobs, causing even more shortages. There is no support from admin, no real plan to retain nurses who are currently working in the jails, nor about how to aggressively recruit during this desperate time. These actions by admin show that staff are not valued or appreciated in their roles of caretakers of the inmates. Admin has made statements that their #1 priority is the care of the inmates, but lack action, which proves that this is not true. It's time to hold the Sheriff's Office accountable for their actions. Please help me do that today. Thank you.
Thank you. Our next speaker is 7613. 7613. You need to press *6 to unmute yourself.
Good morning, Board of Supervisors. My name is Becky Rapp. I'm a mother to 3 teens and youth group mentor. Today, I'd like to thank Supervisor Desmond for his heroic efforts with the Let Them Play initiative. Families across the county are joining you in your efforts and applaud your perseverance. Many teams have resorted to club sports who travel with their teams over state borders to play in tournaments. Sadly, the majority of youth in our county can't afford these expensive activities, leaving them home worrying about their ability to play and how they will compare to many of their teammates who never stopped playing. As you can imagine, this is a very difficult time for teens as anxieties and mental health issues rise. Many are home feeling isolated without positive role models that they would have otherwise received through coaches and teachers. As isolation continues and 11 months have passed since school and sports were open, we are seeing a direct correlation that shows increase of marijuana use among teens. A recent study showed that since COVID-19 social distancing began, the frequency of marijuana use in adolescents increased. 49% of those teens misusing marijuana are using in isolation and at home alone. Mass commercialization and marketing of marijuana to youth decreases the perception of harm and suggests long-term negative effects on our teens. Monitoring the future data proves that vaping marijuana in adolescents has more than doubled, causing detrimental cognitive development. This, combined with the lack of physical interaction like sports, is a disaster for adolescents. The idea of Let Them Play gives hope to the disadvantaged. Let's create a more equitable county, giving fair and equal playing to those most vulnerable. Let them get out and play, limiting the time and opportunity to be home getting high. Thank you.
Thank you. Our next speaker is 6781. 6781.
Good morning. My name is Juan Carlos Davenport, and I am an SEIU Local 221 member. I'm also a records clerk in the probation department and have worked for the county for 5 years. I'm speaking to you today regarding an opportunity that this new board has to truly lead by example, simply through implementing and treating us all by the standards set forth through the county's motto, the noblest motive is the public good. Collectively, you all have a chance to demonstrate the true scale of your resolve and the scope of the belief you share in that phrase to all of us. We are asking for hazard pay. County workers on the front lines of handling the COVID crisis should have equity increases and hazard pay. Our job in probation is rehabilitation, and in this department, the county workforce since day one of all of this craziness has stepped up. It is because of this that some semblance of normalcy has been able to be maintained in our region without the important work of the county, not just within probation, but across the entire region from imploding upon itself. I'm sure this would have occurred if all of us county workers would have put our own needs before the needs of the community. The simple fact is that the county cannot run without public workers, and the county must invest in its employees during this crisis, just as we have invested in it. The county needs to put the needs of its workers first. We are simply asking to be treated with fairness. And to that end, many of my own coworkers in probation have contracted COVID-19, and just in this past week, one of them has died because of it. This is simply because of the nature of the work that we do. We do not always have the luxury of completing work remotely. What's more, the inherent difficulties that have come about because of the pandemic, such as home-based schooling and childcare among a myriad of others, have put a further strain on so many of us. Regardless, we have continued to do our work because we understand that we are a part of something important that is bigger than ourselves. We ask you all to realize the same. This is really bigger than the five of you. I urge you to recognize this fact and give a tangible recompense for the risks and sacrifices that the workers of this county, the entity that you represent, have made and will continue to make until we all get through this together. We have all willingly put ourselves in hazardous situations. We have all answered the call for the greater good of this community, and we have all lived our lives by this motto. It's time to respect us, protect us, and pay us. Thank you.
Thank you. Our next speaker is 7611. 7611. Please press *6 to unmute yourself. If we don't hear from you when we call your number, we'll come back to you. Our next speaker is 9886. 9886.
Good morning, Supervisors. This is Joanne Fields. I'm the Government and Public Relations Director of the Asian Pacific Islander Initiative. I'd like to start off by thanking Vice Chair Supervisor Nora Vargas for committing to an Asian Pacific Islander virtual town hall on Wednesday, February 17th at 5:30 to discuss the county's role and initiatives that will impact our community. So that will be launching our series of a Civics 101. Next, I'd like to thank Michael Vu for your dedication in your former role as the Registrar of Voter, and congratulations in your promotion to Assistant Chief Administrative Officer. It's bittersweet to see all the changes happening, but change is needed, especially for improvement. Another bittersweet change is to share Chief Adolfo Gonzalez with LA County. I hope Supervisors Holly Mitchell and Hilda Solis will take care of you. It was truly an honor to serve on your Chief's Advisory Group. My colleagues and I learned so much from probation. It's not just law enforcement. Your officers are also social workers seeking the best programs and services to best serve probation clients, youth and adults alike. You listened when we shared that teachers at Morris and Lincoln clusters said to please send officers in plain clothes when they visit our students who may be on probation. That was a major change. You also changed the dinner schedule so that dinner wasn't served too early, and you provide healthy snack options between meals. Serving on the interview panel, we learned about the interview process and who was being recruited into these positions. Your Citizen Academy was enlightening. While it was 8 weeks, we did learn so much, again, of each aspect of probation. You've surrounded yourself with a lot of staff that we know that we are in good hands here in San Diego. Godspeed, Chief.
Thank you. Our next speaker is 6598. 6598. You may proceed. You're unmuted, and you may state your name for the record and proceed.
For the caller 6598, your device may be muted.
Good morning, Board of Supervisors. Thank you for this opportunity to share some comments with you. I want to do a shout out to the workers from the jail and probation. They were echoing some of the thoughts I had for item 13 that my phone number wasn't called for, regarding that the centerpiece for needle exchange programs are actually the associations that the client makes with the caseworker, not so much the exchange of the needle. Thus, it is important, these workers in our jails, the mental health workers in probation, and that's where our money needs to be spent, is on people. And I think it's overthinking it to think that the exchange of the needle is really making any difference. If you were to run the data and find out how many people who exchange needles actually were referred to the program, went to the program and completed the program, I think you'd get a broader view of this program. What I actually was calling in for public comment was concerning some reporting that was in the UT this morning regarding the Sheriff's Department that I thought was inaccurate. It was an article written by Gary Worth this morning about your two meetings today and tomorrow. And one of the quotes was that the Sheriff's Department is busy shutting down illegal and unregulated marijuana businesses that keep opening in the unincorporated area. What it didn't go on to say is that this has been true in cities where marijuana businesses are permitted. The problem isn't with unpermitted and permitted, it's just that there's a lot of money in the black market, and permitting businesses doesn't change that. In fact, data out of LA suggests that permitted pot shops love doing this sort of business because they sell out the front door permitted and out the back door in the black market. So let's not misunderstand what permitting marijuana businesses would do. There was also a comment that marijuana businesses would bring a lot of revenue to the county. Again, this is misinformation. As the city of San Diego has found out, it's needed to make a department that they at $1 million a year just to handle the concerns and problems associated with the marijuana businesses. So they collected taxes, but they had to compensate for it with the program. And Vista, also permitting pot shops, had to add extensive staff, one of which was a forensic bookkeeper at considerable expense, so that they actually received their taxes. Thank you.
But could you please state your name for the record before you go?
Yes, Judy Strang, District 3.
Thank you very much. Our next speaker is 3228. 3228.
Good morning. This is Katie Moretti calling from beautiful snowy Julian, California. And I am calling to express my disappointment with the chair, Nathan Fletcher's recent comments about the efforts for the people that have signed the petition to recall Governor Newsom. This is a right that is protected under the California Constitution, and such words as neo-Nazi, white supremacist, and militia have no place in our county. We need to get through this COVID crisis. We need the county supervisors to concentrate on our businesses, our schools, and our people that are affected by this, and not join in on the rhetoric of political unnecessary statements. I encourage the Supervisor Fletcher to look at who is signing these. They are people that businesses have been shuttered, parents whose children are not being educated properly, and a number of people who are unhappy. So it was an unfair statement, and I'm just very disappointed that it happened at the county. I think the supervisors have an important job to do. You're elected by the people for the people, and let's not lose sight of what is important in this COVID time, and that is the businesses and the citizens of San Diego County. Thank you very much.
Thank you. Our next speaker is 3849. 3849.
Hello, can you hear me?
Yes, hello.
Hi, good morning. This is Leslie Massland, SEIU Local 221 member and a county librarian for 6 years, currently reassigned to T3 COVID testing. A far cry from the days of teaching ESL, citizenship, and art classes to the public. I have seen site managers and registered nurses stressed out about running out of test vials, swabs, gloves, bottled water, and face shields, all PPE that are essential to remain safe while performing our duties as disaster workers. This is why we are asking for hazard pay. The CAO spoke at an evening meeting with SEIU members and told us that the county had a warehouse of PPE to provide to county workers. This narrative was not reflected at the front line as COVID response staff saw supplies run out or requests denied while other county departments were able to order them without a problem. COVID response sites shouldn't be reduced to begging for PPE in the pandemic. Whatever happened to one county, one voice? This disjointed approach from the Board of Supervisors throughout 2020 has turned a crisis into a political pissing match instead of a unified response, which prioritizes employee safety and quality of life. We have human resources officers defining COVID-19 exposure differently between departments, splitting hairs between personal and professional exposure and ignoring California state laws like AB 685 entirely, while others notify all employees potentially exposed to COVID. Supervisor Desmond, last time hazard pay was brought up to the board, you claimed county workers were doing God's work. Easy words to say while teleworking from your ivory tower. We are not martyrs. We work in public service, but we are not servants to be used as fodder. The noblest motive is the public good, and county employees are part of the public. We are part of the communities we serve and strive to enrich with our expertise as trusted librarians, nurses, and social workers like Rhonda Felder. We cannot serve from an empty breadbasket, and county workers are starving after decades of inequity of pay. It's high time to respect us, protect us, and pay us. Thank you.
Thank you. Our next speaker is 7611. 7611. If you'd like to address the board on non-agenda public comment, please press *6 to unmute yourself. 7611. If not, 9702. 9702.
Good morning, supervisors. My name is Avery Ware. I'm a social worker with Adult Protective Services and a member of Local 221. I want to make 3 points, starting with some additional points about hazard pay, not to reiterate what has already been said. As we know, at least one county employee has died after we returned to work to face COVID exposures on the job, Rhonda Felder, over the summer. In my program, Adult Protective Services, I've been amazed to find that the majority of South Bay social workers, once we returned to home visits, had visited homes with COVID. We don't have to visit homes if we know that there's COVID, but we don't know. We get out there and we find out that it is the case. And so as long as home visits remain on the horizon, they're currently shut down since we've entered the purple tier, but I imagine would be restarting. The risk to ourselves and our families, many of us live with other people. We would not be able to prevent exposures to people with pre-existing conditions or advanced age, even if we personally don't suffer from those conditions, and some of us do. So we're definitely putting ourselves at risk. It's clear also that with the spread, the demographic spread of the virus, that this disproportionately impacts the Latino community and reinforces historic structural racism. Racism is a public health crisis in San Diego, as we've talked about, and this is a graphic example, and it affects the predominantly Latino workers who are Spanish speakers posted in the South Bay section of Adult Protective Services. Secondly, I wanted to address the issue of stipends for working from home.
Sir, thank you. Your time is up. Thank you.
I'm sorry, what?
Your time is up.
Oh, time is up. Okay.
Thank you.
Okay.
Our next speaker is 3733. 3733.
Good morning. My name is Haney Hong. I'm the president and CEO of the San Diego County Taxpayers Association. Chairman Fletcher, members of the Board of Supervisors, thank you for your leadership. We are here standing by, ready to help you and assure the public value that you wish to create is effective and efficiently delivered with the limited financial resources in our public treasury. We've been a leading independent voice in the region on efficient and effective public policy for 75 years. For the audience here, just want to remind that we're a nonpartisan, nonprofit association of individual business and organizational members. We seek the optimal returns on taxpayer investments. We're not anti-tax, we're not special interests, we're not partisan, we're just here for the day-to-day taxpayer asked on a daily basis to give up some of their resources through taxes in the pursuit of shared public goals. We're excited about the direction that all of you will take the county and excited about thinking about new ways to deliver public value. In fact, we like these new ideas because sometimes doing business the same old ways does not achieve optimal returns. That said, my membership are also committed to assuring that fiscal prudence, managerial acumen, that those two things I just mentioned are core tenets to any new proposals. We believe that truly bold leadership embraces that prudence and managerial acumen because that's what sustains any new endeavor. Any entity, whether it's the county, public, or any nonprofit or for-profit, can't attain its goals without appropriate financing. And we recognize, for instance, that sometimes you have to do one-time expenditures, but those should go with one-time funds. Similarly, long-term endeavors should require long-term commitments and long-term revenue streams. That long-term finance does not always have to be new taxes or fees. They could be attained with structural reforms that reduce costs in other areas of the county's mission. Just want to say we look forward to working with you to achieve and sustain the vision of San Diego that you all have been elected to lead, and we thank you for your service.
Thank you. This is the final call for the speaker with last four digits 7611. 7611. If you would like to address the board on non-agenda public communications, please press *6 to unmute yourself now. So Chair Fletcher, that's our final speaker on non-agenda public communications.
All right, thank you. We will now proceed with the formation of the consent calendar. Before I go to my colleagues, I will ask the clerk of the board if there are any requests from the public to pull items on today's consent calendar.
Thank you, Chair Fletcher. Item 1, I'd like to make a note for the record that there is an errata that has been distributed to the board and posted online for the public. There is a minor change to recommendation 6 in that item. The recommendation 6 would change the phrase amend existing contracts to negotiate amendments to existing contracts. With that note in the record, this item may remain on consent. Item 2 has been pulled by the public. I'll also note that there is an errata that has been distributed to the board and posted online that makes minor changes to recommendation 2, changing the phrase amend contracts to amend subject to negotiations and a determination of fair and reasonable pricing contracts. So again, item 2 has been pulled by the public. Item 3 has been pulled by the public. Item 7 has been pulled by the public. Item 11 has been pulled by the public. Item 14 has been pulled by the chair. And item 15 has been pulled for a brief presentation by the Chief Financial Officer. Item 20 are closed session matters that will be considered at the conclusion of the board's public session. All the remaining items on the Board of Supervisors agenda may be placed in the consent calendar for your board's consideration.
Thank you, Mr. Clerk. I'll now go to my colleague, Supervisor Anderson. Are there any items you wish to be pulled for discussion or comments to make? Supervisor Anderson. Okay, we will go first to Supervisor Lawson-Remer.
Thank you, Chair Fletcher. I'd like to pull item 6. And I think it already was pulled, but just confirming also items 7 and items 14.
Items 7 and 14 have already been pulled. So we will add item 6 to that.
Thanks.
All right. Would that be a motion to approve the rest of the consent calendar?
That would be a motion to approve the rest of the consent calendar. Thank you, Chair Fletcher.
We'll now go to Supervisor Desmond.
Yes, I just have a clarification. Andrew went pretty fast for me. Is item 13 pulled?
Item has already been voted on and passed.
I'm sorry. I apologize. I have no other items to pull and no comments. Thank you.
Thank you, Supervisor Desmond. Supervisor Anderson?
I don't have my, are you calling for the vote?
No. We're just, if you have any items to pull.
No, I'm good to go. Thank you.
Perfect. Thank you. Supervisor Vargas?
No additional items to pull. I do have some comments on some, but I'll wait until that item comes before us.
Got it. You have comments on items that have been pulled.
I have items on comments on item number 2 and number 3, amendments on number 2 and 3, but I'll wait until those come before us.
Yep. Those have been pulled. Okay, perfect. All right. Thank you. I have no items to pull. I do want to make brief comments on agenda item number 9. The action related to agenda item 9 is asking the board to authorize County Health and Human Services to joint apply for the state mental health wellness grant for child and family. This would request funding of approximately $8.4 million on behalf of Fred Finch, a local nonprofit, to acquire and renovate a 25-acre campus in San Diego County. Serving as the co-chair of the Child and Family Strengthening Advisory Board, I have learned and seen the pressing demand for crisis mental health care residential services by a special cohort of youth, including those served by our child welfare system that have unique needs. Currently, these youth are being served out of our county and some out of our state due to a lack of services to provide this level of care here locally. This is especially true for youth that have both developmental disabilities like autism, along with severe emotional disturbance. Serving youth in settings far from home is not a best practice, as it makes it challenging to maintain family and friend connections, which is critical to the youth healing, the long-term success. It's also critical to just the humanity of those family members to be able to visit and be around their youth. Out-of-county placements for youth that are wards of the county also increases the cost for our system of care and requires great travel to try and check on these locations. And so Fred Finch is a community-based provider. They have a great track record serving youth in our child welfare and other vulnerable youth in our community suffering from emotional disturbance. They provided expertise, providing mental health care services in other parts of California, and we'll be able to draw on that experience in bringing the services to San Diego to further build out our continuum of care to serve our youth. It is timely that a beautiful property with a large campus, serene landscaping for recreation and other activities has become available to meet this pressing need. Some of you might be aware that recently the state rescinded all out-of-state residential placements for ward of the court temporarily due to poor conditions in many of these programs. This new facility will go a long way towards helping us meet this important need moving forward. We want our youth that are facing behavioral health challenges to be set up for success. We want them to be closer to home, receiving quality care in San Diego. And I think this is a very important step forward. And I appreciate all the work of those involved, all the members of the Child and Family Strengthening Council and others that have worked so hard to bring us to this point. So with that, we have a motion by Supervisor Tara Lawson-Remer, a second by myself, to adopt the consent calendar minus those items which have been pulled. I will ask the clerk just to clarify one last time before we vote the items that have been pulled, and we will need to take up after we adopt the consent calendar and then to call the roll for the vote.
Thank you, Chair Fletcher. Item 16 has also been pulled by the public. So I'll just run through the items that have been pulled by the public. That's items 2, 3, 6 has been pulled by Supervisor Lawson-Remer. Items 7, 11, 14, 15, and 16. With that,
call the roll.
Supervisor Anderson?
Aye.
Supervisor Lawson-Remer?
Aye.
Supervisor Desmond?
Aye.
Vice Chair Vargas?
Aye.
Chair Fletcher?
Fletcher, aye.
That motion passes unanimously with all supervisors being present and voting aye.
Thank you. I think what we'll do is move to agenda item number 7. We have a fairly comprehensive presentation on our COVID update. We also have a significant number of speakers that I would like to get to before we get to a lunch break. And so we will take up, we also have Dr. Natasha Martin from UC San Diego who is standing by. And so we want to get through the presentation on item 7 to accommodate our special guests that are here, and then also ensure that the callers that are here have an opportunity to have their voices heard before we begin board deliberation, with the intent to get through this If we have extra time, we'll take up a few of the other items and we'll recess briefly for lunch and come back and complete the items. With that, I will turn it over to the clerk to kick off agenda item 7, receive update on the COVID-19 response.
Thank you, Chair Fletcher. Any members of the public that have requested to speak on this item, please dial into the conference line now using the instructions provided to you. You will be muted until it is your turn to speak. Thank you.
Good morning, Chair Fletcher and members of the board. Today's COVID update presentation will start with our Public Health Officer, Dr. Wooten, who will provide a public health update as well as additional information on the county's status on the state's tiered system. As part of the public health update, we'll be joined by Dr. Natasha Martin, Associate Professor at UCSD in the Department of Medicine, Division of Infectious Diseases and Global Public Health. Dr. Martin will provide an update on local projections. We'll then be joined by Nick Mascione, our agency director, for an update on the testing and vaccination efforts underway throughout the county. Additionally, Vince Nicoletti, our lead on compliance, will provide an update on compliance efforts throughout the county and review previous board guidance. Then we will receive an update on funding sources and economic impacts of COVID-19. Starting with Andy Pease, our Incident Command Finance Chief, who will provide an update on funding sources. Following that, David Estrella, Director of Housing and Community Development Services, will provide an update on the Rental Assistance Program. To complete our presentation, Ebony Shelton, Chief Financial Officer, will present updates on the economic impacts of COVID to the region. Without further ado, I'll welcome Dr. Wooten.
Thank you, Don. Good morning, Chair Fletcher and members of the board. The epi curve on this slide shows COVID-19 cases by onset of illness and provides a historical overview of cases to date. Because we reviewed this slide in detail at our last presentation to your board on January 12th, I will bring your attention to the more recent months of activity. On November 10th, San Diego County transitioned to the purple tier due to high cases or case rates and testing positivity percentages. With cases continuing to rise, on December 6th, the state implemented a regional stay-at-home order for Southern California, which includes San Diego and 10 other counties. The criteria for this order was intensive care units or ICU admissions below 15% for the region. For the next 7 weeks, ICU capacity for the southern region was 0%, and many business sectors were closed for indoor and outdoor operations until yesterday, January 25th. I will talk about this in more detail shortly. From January 1 through January 25th, the daily case counts have begun to slowly decline after the first 7 days of the new year. A significant rise in cases above 4,000 from the end of December into early January was followed by a slow decline over the next 17 days from January 8th through the 24th. Case counts have continued to slowly decrease to below 3,000 daily cases in the past week and to below 2,000 cases in the past few days. We will continue to be cautiously optimistic to see an ongoing decline in daily cases. A new variant of the SARS-CoV-2 virus circulating in the community could, however, impact this decline, as we will hear from Dr. Natasha Martin shortly. Since the last presentation to your board on January 12th this year, an additional 33,837 laboratory-confirmed cases have been reported, for a total now of 228,635 positive COVID-19 cases. These numbers are as of 11:59 Sunday, January 24th. This table provides a summary of cumulative cases with a breakdown by age, gender, hospitalization, ICU admissions, and deaths. The age range of cases is from 0 to now 108 years of age, with a median age of 36 years. The 20 to 49-year-old age group continues to comprise approximately 54% of all cases at 124,305 of the total number of cases. Gender remains relatively unchanged. Hospitalizations make up 3.9%, or 8,875 of all cases. 1,357 of those hospitalized have been admitted to the ICU, and this number is approximately 0.6% of the total number of cases and 15% of the total number of those hospitalized. Also, the total number of cases includes 2,375 deaths, or 1% of all cases. All demographic information and more data can be found at the county's website, www.coronavirus-sd.com. In the next slide, it shows the comparison of monthly community setting outbreaks since the beginning of the pandemic, with the largest number occurring in November and December. All of these community setting outbreaks represent just over 3% of all of the cases. November had 243 outbreaks, representing 1,885 cases, and December showed 245 outbreaks, representing 1,410 cases. While we are now just 3 weeks into the month of January, the number of outbreaks are more than half of those seen in each of the prior 2 months, at 156 outbreaks, but representing 711 cases. Since November 1st, 644 outbreaks, representing 4,006 cases, accounted for 53% of all of the community setting outbreaks that have occurred during this pandemic. Examining the various sectors where community setting outbreaks have occurred since November 1st, the top sectors include number 1, businesses, number 2, restaurants and bars, number 3, preschools, number 4, faith-based and government sectors, and then healthcare rounds off the top 5. Going to the next slide, as stated earlier, due to the continuing rise in COVID-19 cases across California, in December, the state implemented a new regional stay-at-home order to stop the surge of COVID-19 cases and prevent a strain on our healthcare system. This order was issued if a region's ICU capacity was less than 15%. On December 6th, the Southern California region met the criteria for the state health officer order. On January 10th, 4 of the 5 regions had an ICU capacity less than 15%, with Southern California at 0%. As of January 25th, the state's 4-week projection showed an ICU staffed capacity above 15% for all of these 5 health officer regions in the state of California, which lifted the regional stay-at-home order statewide effectively yesterday. The projections are noted in the lower left corner of this slide, and Southern California is projected at just over 33%. Despite the lifting of this order, we must all remain vigilant and continue to wash our hands, watch our distance, and wear a face covering. These are CDC's 3 W's, while also limiting our gatherings. Together, we have made progress in the past and in recent weeks. Adhering to the current state and local health officer orders, we can slowly reopen to support the economic health of our region. Now, this slide shows the status of San Diego County's non-federal hospital adult and pediatric ICU beds. The number in the blue bar show the number of patients in an ICU bed for COVID-19 related reasons. The numbers in the orange bar are for patients in ICU beds for non-COVID related reasons. The number in the green open box show the number of beds that are staffed and immediately available to take ICU patients. As of January 24th, the hospital system had 47 beds, approximately 6% of the total bed capacity, that were staffed and immediately available for a patient to be admitted. Now, in the next slide, with almost the entire state in the purple tier, San Diego County case rate and testing positivity remains elevated. As we wait for the state to post this week's calculated metrics, we are showing metrics based on our staff's calculation of local data. The unadjusted case rate for January 10th through the 16th, after a 7-day lag, is 67.7, with the adjusted case rate at 49.6, and the testing positivity at 12.6%. These results land San Diego County in the purple tier. Staff has also calculated the health equity positivity metric to be 16.7%, also characteristic of the purple tier. In the next slide, from another view, this slide shows the trend of the unadjusted and adjusted case rates over time. Note the threshold for the case rate to be in the purple tier is 7.1 or higher per 100,000 population. Given the current adjusted case rate is almost 50, San Diego County is still has a long way to go to reach the threshold to be in the red tier, which is 7 or less per 100,000 population. Now, with the lifting the restrictions of the stay-at-home order and being back in the purple tier, there are some business sectors that are now allowed to be open with modifications. Although reopening brings risks of increased transmission, we are better protected because some vulnerable San Diegans, including older adults and critical healthcare workers, have been vaccinated. Our healthcare system has adapted and able to manage higher rates of hospitalizations, and the holiday season when families traveled and gathered is behind us. We hope we do not need to resort to such strict measures again to keep our healthcare system protected and to save lives, but it remains a possibility. With everyone's continued collaboration, we hope to continue on the path to reopening. Now, in addition to the cautious news about COVID-19 declining daily case counts, there is also a new viral strain that is a potential threat. Scientists have labeled this new strain as B117, which was first detected in the UK in December 2020, but traced actually back to September 2020. It was detected next in the United States, specifically in Colorado on December 28th, and 2 days later, it was detected in San Diego County on December 30th. Now 12 states and 50 countries have identified the new variant. On January 24th, in San Diego County, there have been 87 confirmed cases, which is 49 more cases than reported to your board 2 weeks ago. 30 cases have been epi-linked to variant cases, and of the total cases, there have been 1 death and 2 hospitalizations. The median age is 30, and the age range is 0 to 77 years of age, and gender demographics is very similar to the cumulative number of COVID-19 cases. The county is working with Dr. Natasha Martin, who has developed modeling projections. Dr. Martin has presented to our board previously on COVID-19 modeling, most recently on December 8th. Please welcome Dr. Martin to share her findings.
Good morning. Thank you, Dr. Wooten. Can I confirm you can hear me with my mask on okay? Thank you. Okay, I'm here today to talk about our modeling work that we've done about the expansion of the B11 strain, and I'd just like to acknowledge on the first slide were collaborators of mine at UC San Diego, Scripps, as well as San Diego County Public Health that have worked on this work with me. So the emergence of the, next slide, please, thank you. The emergence of the B117 variant strain of the SARS-CoV-2 virus led to a rapid expansion across the UK, Portugal, and Ireland. It quickly became the dominant strain there. This particular variant is estimated to be 50 to 70% more transmissible than previous variants, leading to surges in cases, as you can see on this slide. There is recent evidence that it may lead to higher mortality as well. The B.1.1 strain was first detected in San Diego on December 30th, as you heard from Dr. Wooten, and is now estimated to comprise 5% of circulating strains. The question is not whether this strain will become dominant, but how long it will take and what effect it will have on our epidemic trajectory given its increased transmissibility. Next slide. So to understand this, it's useful to look at how transmission has changed over time in San Diego. One measure of transmission is what we call the effective reproduction number, or RT. The effective reproduction number is the average number of people that will become infected by a person infected today. So if RT is greater than 1, then an average person infects more than one person, and then cases will increase. Whereas if the RT is less than 1, then the cases will decrease. So this slide shows that effective reproduction number over time in California. It's estimated to be similar in San Diego. And you can see here that even during the stay-at-home orders in April, the RT was only slightly less than 1 at about 0.9. During our surge periods in July and December, it increased to between 1.2 to 1.35. And corresponding to the drop of cases that we've seen since the New Year's peak on the very right-hand side of the slide, RT is currently approximately 0.9 again, but it's fairly uncertain. It could be around 1 or even slightly above 1 right now. So importantly, even if the effective reproduction number right now is less than 1, again, meaning that every infected person infects fewer than one next person, if we have a 50 to 70% increase in transmissibility due to the B.1.1.7 variant, then that could increase the reproduction number again to above 1, and cases would be expected to increase, possibly quite dramatically, as I'll show you on the next slides. Next slide. So to explore the possible impact of the B.1.1.7 expansion, we developed a simulation model of SARS-CoV-2 transmission. The model is age stratified and simulates infections with 2 different strains, the B.1.1.7 variant and non-B.1.1.7 variants. We assume that this B.1.1.7 variant is 54% more transmissible based on our current evidence and 5% of existing strains in San Diego County. We incorporate the effect of vaccination, and we parameterize the model to San Diego County population in terms of size, estimates of previous infection, vaccination, as well as vaccination prioritization by age. And we use this model to look at 3 different scenarios shown here on the right-hand side. The first scenario examines cases without any future vaccination and assuming behavior stays the same. We then examine the impact of a robust vaccination program of 6,000 doses a day in January, increasing to 20,000 doses a day in February. And the final scenario examines the impact with the same vaccination program, but simulating a potential increase in transmission in about 2 weeks' time due to increased activity associated with reopening. For this scenario, we assume similar transmission to what occurred during the Thanksgiving periods or during our period of reopening in July. Next slide. So here we show the 2 possible scenarios of future daily cases, starting with roughly 3,000 diagnosed cases per day as we've seen over the past week. Now remember, I told you that the current reproduction number is uncertain, somewhere around 0.9 or 1. So the top figure shows a scenario if our current reproduction number is 1, and the bottom figure shows a scenario if the current reproduction number is 0.9. In these figures, the blue represents the non-B.1.1 strain, with the red representing the B.1.1 variant strain. And as you can see, the blue strain is predicted to decline in both scenarios as the B.1.1.7 red strain expands and becomes the dominant strain due to its increased transmissibility. This increased transmissibility has important effects. If we are currently in a scenario where the effective reproduction number is 1 in the top figure, then right now each infection results only in 1 more infection, so that naturally cases would remain stable. But as the B.1.1 strain expands, because it's more infectious, it increases the reproduction number to above 1, causing cases to increase dramatically on the right-hand side with that red peak. These projections estimate that in this scenario, there would be over 6,000 cases per day in the top figure, which would overwhelm our health systems. Even in a more optimistic scenario on the bottom, where with the effective reproduction number is 0.19. Again, this 50 to 70% increase in transmissibility could reverse the declining case trend after about a month and then lead to increasing cases again, even without any behavior change. So I think there are three important points to take from this figure. The first is that reducing transmission now and bringing our reproduction number down, say from the top scenario to the bottom, is critically important in preventing the expansion of the B117 strain, as well as the emergence of any other new variants. This will flatten the curve and buy us time to increase vaccination numbers. Second, we could see a potential impact on a substantial vaccination program, shown on the next slide. So here in the second panel of figures, we can see the important impact of this vaccination program on flattening the curve and mitigating the expansion of the B117 variant. In both scenarios, vaccination now can slow down transmission of the variant and reduce cases, even accounting for the fact that we're prioritizing older individuals who have lower case rates and are less likely to transmit the virus. If we are in the top left scenario, we need to both reduce transmission and expand vaccination to bring us to the bottom right scenario in order to control cases. So both of these elements are critically important in managing this potential surge. Next slide. And finally, the final panel of figures on the right illustrates the caution with which we need to approach reopening. In a scenario where contact rates increase in 2 weeks' time due to reopening activities, a substantial surge would occur exceeding our healthcare capacity in all the scenarios, even with vaccination, potentially looking at a scenario with 7,000 cases per day. Currently, 3.9% of reported cases result in hospitalization, and 1% result in death. So this scenario would significantly strain our hospital capacity. And I would like to add that there is some emerging data that the B117 is more lethal, so we could expect even more deaths than we're seeing now for every case. I can't stress this enough. With the emergence of B117 and other strains which may be more transmissible and potentially more lethal, now is the time to double down on reducing transmission and expanding vaccination, and we need to be extremely cautious about reopening and monitor the situation closely. Next slide. So in summary, B117 will become the dominant variant in San Diego, likely in a matter of weeks. The increased transmissibility of B117 and other emerging variants could strain healthcare resources, especially if exacerbated by reopening activities. We can and should prepare for scenarios that you have seen in this presentation. In the coming weeks, we need to urgently focus all efforts on reducing transmission, ensuring a robust vaccination response, and approach reopening with caution. Viral mutation is inevitable, but lowering the amount of circulating virus will both delay the expansion of the B117 variant and reduce the chances of other variants arising with increased infectivity and mortality. Finally, as you've seen today, I've shown potential modeled scenarios instead of precise projections because of the uncertainty. As we collect more data, we'll revise our projections and this uncertainty will reduce. Nevertheless, despite these uncertainties, our modeling for San Diego, corroborated by similar national modeling published by the CDC last week, points towards B117 expansion as an urgent threat requiring a comprehensive response. Thank you, and I'll hand it back to Dr. Wooten.
Thank you, Dr. Martin. In closing, this is still a precarious period, and we urge all San Diegans to continue to follow all health precautions. In alignment with the CDC, and the state, please wash your hands, watch your distance, and wear your mask. If you are sick, isolate at home and get tested. And when it is your turn to receive the COVID-19 vaccine, get vaccinated. San Diego County community residents heard the urgent message to stay at home in December. The surge associated with the December holidays was intense, but our collective efforts are helping to lessen the strain on ICUs and on the path to slowly reopening our local economy. Please continue to remain vigilant and help all San Diegans be COVID safe. Now please welcome Agency Director Nick Machione.
Thank you, Dr. Wooten. The COVID-19 vaccinations is a linchpin to ending this pandemic and returning to normal. Our goal is to vaccinate 70% of San Diego County residents age 16 and older by July 1st. As you know, COVID-19 vaccine currently is not recommended for those younger than 16 years of age. Now, to meet that goal, and considering that this vaccine is a 2-dose series, we estimate our region will need to provide about 22,834 individual doses a day for the next 150 days, starting February 1st and ending July 1st. The county's vaccination strategy is guided by what we refer to as the 5 C's framework. First, starting with confidence. We have to ensure there's clinical and public confidence, not only in the vaccine itself, but in our vaccination efforts and at our sites. Second, communication and collaboration, working with and engaging partners and stakeholders from all sectors and ensuring that we help connect the unconnected in getting vaccinated. Convenience, ease of access to the vaccine for individuals in the appropriate phases of the rollout, cultural responsiveness, being sensitive to unique needs of our diverse communities throughout the county. All of this to deal with complacency, making sure all San Diegans understand the importance of the vaccine for themselves, their family, and the resiliency of our region. And at the heart of this entire strategy is health equity. For instance, the map on the slide that you see is based on the state's metric for health equity, which uses the Healthy Places Index. The Healthy Places Index score is a census tract based on numerous factors, including education, healthcare access, and other environmental factors. The dark green reflects census tracts that have the most health opportunities, whereas the dark blue reflects census tracts that have the least health opportunities in our what we call the health equity quartile. We know from our data that those living in the health equity quartile are most disproportionately affected by COVID-19. They have the greatest health inequities. Our vaccination strategy is focused on prioritizing access to the vaccine for those living in those areas. Now, our regional ecosystem for our county's COVID-19 vaccination is both robust and growing. And we're building on the success of our T3 approach to locations. First, the County of San Diego is taking on a lead in setting up vaccination locations, also known as point of dispensing sites or pods. We're working with our hospital partners on what we're calling vaccination superstations, essentially high volume sites that can vaccinate up to 5,000 or more individuals a day. The county is also setting up mobile vaccination teams who will go out to places such as the long-term care facilities to help vaccinate our most vulnerable. County Fire and other fire agencies in our cities have been stepping up and leading this charge. Our hospital partners have also joined us to host community vaccination efforts, often on or near their hospital campus. And these are in addition to the medical providers vaccinating their health plan members. And vaccinations are also being provided by community health clinics, which are trusted providers to many San Diegans as they serve as their medical home. As I referenced before, many cities have already begun partnering with the county and County Fire. I'll also mention school districts have also stepped up with their school nurses as well. City paramedics and EMT staff are now focusing on long-term care facilities, and they're also looking at operating public vaccination efforts and events within their city jurisdictions. While we do not currently have the data for what we know the military and veterans administrations are providing vaccination to personnel, we know that there is a fair number of our San Diegans also getting vaccinated by those groups. Additionally, pharmacies are allowed to provide COVID-19 vaccinations and are doing so, much how they already provide flu vaccinations. Let's hone in now on the county efforts. We currently have 9 county-hosted vaccine sites, 2 vaccination superstations in the cities of San Diego and Chula Vista, and 3 hospital county partnership sites. We estimate that we have a daily capacity of approximately 12,000 vaccines per day. And we plan to continue to ramp up our capacity in next month to reach 12 county-hosted vaccine sites located throughout the entire county and 5 of these vaccination superstations. As I mentioned, the one in City San Diego is at Petco Park, led by UCSD Health, our first. Our second was in South Bay in Chula Vista, led by Sharp Healthcare. And we're currently working to quickly stand up the East County site that will be led by Sharp Healthcare, and also in North County site that will be led by a partnership of Tri-City Medical Center, Palomar Health, UCSD, and our own Health and Human Service Agency. And in addition, there'll be a 5th superstation that will follow in the North Coastal region that will be led by Scripps Health. And as we plan to have 6 to 8 hospital partnership sites, more interestingly, the most current hospital county site that will be opening later this week is in the city of Escondido by Palomar Health. Collectively, all of these sites in our vaccination ecosystem put us at a minimum of 25,000 vaccines per day, well above our regional goal of 22,834. And as other health entities in the region join us, and as vaccines become more readily available to us from the state, we hope to reach 70% of our population well before July 1st. Now, as I mentioned before, health equity is of the utmost importance in guiding our work. We have ensured that we're placing vaccination sites in those communities hard hit by COVID-19. In addition to our vaccination sites, there are many other vaccine access points that are becoming available to San Diegans. This group includes medical providers who are required to provide vaccinations to their staff members, health providers such as hospitals and clinics who are already setting up vaccination clinics, and others like Kaiser Permanente who have announced that they would be reaching out to their members to schedule their vaccinations upon vaccine availability. Pharmacies, as mentioned earlier, also approved providers. As part of the Federal Pharmacy Partnership Program, CVS pharmacies and Walgreens are providing on-site vaccinations to skilled nursing facilities and long-term care facilities. Other vaccination providers include community health clinics and medical group practices, again, many of them waiting to get vaccine and ready to give it to their members. But also we have the Military and Veterans Administration and the tribal health programs and urban Indian organizations doing vaccinations. Well, currently we are vaccinating all of Phase 1A, which includes healthcare workers, residents of skilled and assisted living facilities, public health staff, behavioral health outpatient and inpatient clinics, as well as many other healthcare groups. Additionally, we're vaccinating individuals aged 65 and older. We estimate that there are about 635,000 individuals in Phase 1A and approximately 300,000 San Diegans aged 65 and older. That's nearly 1 million individuals. As a safety net provider for our entire region, our county team is supplementing our medical care providers by offering numerous county vaccination sites and partnering, as I mentioned, with our healthcare providers. More information about our vaccination sites located throughout the county can be found at our county website, www.vaccinationssuperstationsd.com. As of today, the total number of vaccine doses that have been administered and documented in what we call our San Diego Immunization Registry, or SDIR, is approximately 236,000. Of those doses, approximately 199,000 were first doses and 37,000 second doses. Now, this data is based on vaccinations that are documented by healthcare providers that are approved by the state of California and who are required to enter their administered doses into our SDIR. It does not include those vaccinations that are administered by the military, the VA, and the tribal entities. We've been working with these state-approved vaccination providers in our region to ensure they enter data in a timely manner, so we have a more up-to-date snapshot of vaccinations administered in our county and ensuring that all vaccines are appropriately administered as quickly as possible. As I mentioned previously, at the present vaccination rollout phase, we have approximately 1 million San Diegans eligible for vaccine in our region. And while we know the supply chain is limited, we're working closely and diligently with our state to request all the doses needed to cover the lives of San Diegans. Now, looking ahead, we continue ramping up our regional workforce as we are most in need of vaccinators for our vaccination sites. We also need a lot more vaccine from our state. But we estimate that we need hundreds more vaccinators and non-medical staff to staff all of our projected vaccination sites. For instance, EMTs, emergency medical technicians, are now allowed to become vaccinators through a recent expansion of the local scope of practice approved by the state of California. We're working on recruiting, onboarding, and training hundreds of EMTs so they could be deployed to the various vaccination sites countywide. We're also bringing on hundreds of volunteers through our Medical Reserve Corps. As it relates to data, we recently began publishing vaccination data online at www.coronavirussd.com, coronavirus/sd.com, excuse me. And this includes demographic data, who has been vaccinated, and we continue to actually work with the state to enhance and add even new data elements to our data reports. Lastly, community engagement. We recently launched an effort through a partnership with 211 San Diego to support those 75 and older with no internet access to make appointments by calling 211. We're also working on a robust communication plan in partnership with our community outreach workers and working additional resources to help people who have difficulty in accessing vaccinations. And with that, now I'd like to turn it over to Vince Nicoletti, who will discuss engagement with the business community. Vince?
On August 4th, the county established the Safe Reopening Compliance Team to serve as the regional lead for complaints regarding possible violations of the public health order. To date, the team has received over 20,000 complaints, working with cities across the region to address them. The team includes a call center that's staffed 24/7, for which complaints are anonymous. We also respond to emails. We've trained team members on approach, helping businesses or entities navigate the health order to come into compliance. California has issued its Blueprint for a Safer Economy that establishes industry-specific restrictions as well as operational criteria. In our compliance efforts, the county team has applied this state criteria as well as the local public health order, which implements state direction at the local level. Upon formation of our compliance team in August, we began outreach with various industries to explain our role and approach to ensuring compliance. Our goal is voluntary compliance, and while we're here to help businesses navigate the health order, escalated enforcement may be taken if the violations occur and continue. In addition to the compliance team outreach, the county has held over 480 telebriefings with various sectors. California has established different restrictions for each industry sector. The county compliance team has applied these restrictions consistently across. Restrictions aren't based on the size of a business or its ownership. For example, the same requirements apply to a large retail outlet as a small retail shop. Similarly, a large restaurant chain would need to follow the same restaurant guidance as a smaller family-owned cafe. When state restrictions change, such as when the stay-at-home order was lifted yesterday, we share updates with customers through emails, telebriefings, and website updates. The county enforcement criteria, California's industry-specific guidance, as well as data the state has identified on how COVID-19 is spread, is available on the county website. This chart shows our average daily complaints each week since the Safe Reopening Compliance Team was established. Each bar represents the average number of complaints received each day of that week. The average daily complaints range from 40 to 50 in the first few months. However, following our movement into the purple tier, daily complaints significantly increased and are averaging 200 to 300 a day in recent weeks. Since the team was established, the goal has always been to resolve violations with voluntary compliance, and this has been accomplished for the majority of cases to date. The compliance and enforcement process is unique for each case. However, the process typically starts with contact with a business or entity in question. Site visits are conducted as well as education, including what steps could be taken to navigate the health order. Staff look for options to modify business operations to resolve the violations, as well as share resources that may be available to help businesses. When it's determined that a violation exists, the business or entity does not come into compliance, a cease and desist order may be issued. Following issuance of a cease and desist order, the county compliance officers will remain in contact with the entity in violation and monitor for any changes that may resolve the violation. When monitoring shows a violation continues, the compliance team schedules a joint inspection with the embedded sheriff team members. If the joint inspection shows the violation still exists, the sheriff's department may issue a citation or submit the case to the district attorney for review. Based on the state lifting the stay-at-home order yesterday, we're contacting businesses that previously received cease and desist orders for which their operation is now allowed. Following movement into the purple tier on November 14th, there was a sharp increase in cases where compliance was not achieved after initial inspection and engagement. As of January 21, we issued 425 cease and desist orders. As we continue to do follow-up inspections for locations that have received those cease and desist orders, we're finding that within a few weeks of receiving them, roughly 2/3 of those locations come into compliance. 1/3 continue the violation. For the 1/3 that remain in violation, the Sheriff Department is referring cases to the District Attorney. This completes the update on compliance. Next, Andy Pease will provide an update with fiscal. Thank you.
Good morning. The County of San Diego continues to spend close to $10 million a week for our county response, our testing, tracing, and treatment efforts, as well as for our COVID income stipend and the Great Plates Delivered program. I will note that the Great Plates 2.0 is scheduled to end effective January 31st based on prior board action. For our vaccine efforts, based on the estimated capacity at just under 12,000 vaccines a day, that could equate to about 2 million a week in our efforts. And once fully ramped up at full capacity, we're talking at over 6 million a week, depending on many factors. A superstation at peak performance of 5,000 vaccines a day is estimated on average to cost approximately $123,000 a day. And a pod where we would issue out about 500 vaccines a day is about $12,000. This is a significant amount of cost we are incurring and will incur. So the question is, where is the money coming from? Because short of any federal or state funding, we'll be relying on our local funds, which was not included in our adopted budget. The good news is the state and federal government have committed and promised funding. The not so good news is for most of these funds, we are still waiting for these dollars and further details. However, I am confident that significant funding is on the horizon. Let me briefly walk you through some of the highlights. As I talked about last time, the governor's proposed budget, released just a couple weeks ago, includes the proposed use of $14.4 billion toward the state's COVID efforts and economic support. There's funding for vaccine distribution, testing, tracing, funding for the safe reopening of schools, for small business grants, low-income tax refunds to individuals, and job and workforce development. Now, while much of the governor's proposed budget is for the next fiscal year, there are billions of dollars the governor is requesting the legislature take immediate action on for this year, and we're watching that. Under H.R. 133, the Coronavirus Response and Relief Supplemental Appropriations Act, $900 billion of federal funds has been authorized for areas such as vaccines, testing, tracing, direct payment to taxpayers, rental assistance, mental health, child care, unemployment insurance, and so on. For most of these programs, we expect that the funding will be routed through the state, and the county would receive through the state, or it might go directly to individuals or businesses or providers, and it won't necessarily be a direct allocation to the county. However, on January 19th, the County of San Diego did receive almost $49 million, $48.8 million, for a new rental assistance program, which David Estrella will be providing an overview on in just a moment. We are requesting the board direct the auditor and controller to establish a trust fund for the emergency rental assistance program, with the interest earned to be retained in the trust fund for the program. President Biden has put forward his $1.9 trillion American Rescue Plan for these same efforts and more. As you can see, the list of a sample of what's included there. As part of this plan, he proposes allocating $350 billion in emergency funding for states and local governments. That $350 billion looks a lot like the CARES Act Coronavirus Relief Fund, which we received last year, but it appears to be broader, as it could also be used to cover lost revenue. So we're watching that very closely. Finally, one more funding source we will be using is FEMA. And last week, President Biden signed a memo expanding the use of FEMA for COVID response. He committed to increasing the FEMA match to 100%. We are reviewing what this expansion covers. We're also looking to see to what degree it may be able to be applied retroactively. So although much is uncertain, there is additional funding that should be available soon, and we'll update the board as we gain more details. And so at this point, I'll turn it over to David to talk about the rental assistance program.
Thank you, Andy. Good morning. The Coronavirus Response and Relief Supplemental Appropriations Act of 2021, or H.R. 133, included $25 billion nationally for emergency rental assistance programs, also known as ERAP, for households economically impacted by COVID-19. H.R. 133 specified that the U.S. Treasury could award funds directly to jurisdictions with populations of more than 200,000. The county applied for and was awarded nearly $49 million. The City of San Diego received $42 million, and the City of Chula Vista received $8 million. The county's program will serve all 16 cities that do not receive their own funding, as well as the unincorporated areas. In addition to the mandated program requirements, H.R. 133 allows some local discretion in program design. This slide shows options for program design elements and recommendations. For jurisdiction, the program recommendation is to make the county program region-wide, except for cities receiving their own Stimulus Act funding, specifically the City of San Diego and City of Chula Vista. The county's funding eligibility was based on the entire county's population, minus San Diego and Chula Vista, which have populations of their own of more than 200,000. For maximum award amount, the program recommendation is to allow for up to 12 months of assistance and no maximum dollar amount, giving maximum flexibility to meet a household's need. The program's intent is to provide sufficient funding to avoid displacement due to eviction. For eligible uses, in general, we're looking to align the county's program with other cities' programs, and we recommend awarding funding for both rent and utility assistance. For additional preferences, the program recommendation is to use the Healthy Places Index, in addition to the mandated preferences for prioritizing applicants. The HPI combines 25 community characteristics in a single indexed HPI score. The HPI scores can be compared to paint an overall picture of health and well-being in specific geographic areas. This slide shows high-level differences between the current county ERAP program and the new program funded with the 2021 federal stimulus. We anticipate having all of the $27 million from the current ERAP program awarded by the end of February. To date, approximately $19 million of the funding have been awarded to over 7,000 households across the region. You'll see that there are additional requirements with the new 2021 program, but also added flexibilities. Just as with the last ERAP, we will make every effort to outreach throughout the community. Materials will be translated into multiple languages. Flyers and frequently asked questions are shared with Southern California Rental Housing Association, 211, Legal Aid, Regional Task Force on the Homeless, and the county's network of community partners. These entities have memberships that include nonprofits, stakeholders, and community groups throughout the region. The county will publicize via social media posts on Twitter, Facebook, and Nextdoor regularly throughout the time the applications are available. Applications are primarily taken online, and 211 and county staff will answer calls and assist those without internet access or in need of additional language services. Operators can answer questions and can actually fill out the application on the caller's behalf. Next slide, please. This slide shows how applications will be prioritized for review. Per H.R. 133, the program must have an application process that prioritizes 1, households that have an annual income of 50% or below area median income. In our region, for a family of 4, this is about $57,000. For a single-person household, it is about $40,000. Or 2, households with at least one unemployed member as of the date of the application and have not been employed for 90 days. Households can meet one or the other of these situations to receive the mandatory prioritization. Also, local jurisdictions can create additional preferences in the distribution of rental assistance. The county will use health equity data to provide priority application review. After the application period is open for 2 weeks, the county will take all submitted applications and determine which one meets the mandatory prioritization. This is reflected as step 1 on your slide. The county will take that subset of applications and determine what healthy places index quartile each application belongs in based on the location of the applicant's residence. That's step 2. The county has generated the census tract level HPI data set into quartiles within the county, with the lowest quartile representing census tracts with the least access to health opportunities that predict life expectancy. Those applications that meet the mandatory prioritizations and are geographically located in the lowest HPI quartile will be the first to be assigned for review. The county will continue to assign for review within this subset meeting mandatory prioritizations based on the quartile location. Of the total allocation of $4.8 million, 10% or $4.8 million will be used for administration of the program, leaving approximately $44 million for assistance payments. This chart shows some rough estimates of the number of awards that could be made with the $44 million. If you assume a $1,350 per month rent and $150 in utilities per month, the number of households served could range from 2,400 all the way up to 7,300, depending on the number of months of assistance requested by the applicant. If we assume a rent closer to the San Diego County average rent of $2,375, the number of households served could range from 4,300 households to 1,400 households. We estimate that there are about 274,000 households in the program area that are at 80% area median income or lower, with 173,000 of those households being renters. As an example, if 20% of the renters are estimated to be behind on rent, we would anticipate 34,000 renters in need. If we were to provide each of these 34,000 households with 12 months worth of assistance from the $44 million, we would be providing $1,294,000 per household, which is less than roughly $108 per month. Due to the urgent need of this assistance, the county has an accelerated timeline to implement the new ERAP. Program mobilization is currently underway, including development of policy and communication materials, obtaining, equipping, and training staff to process applications, and the development of the IT system to allow people to apply and submit the required information. The initial online application period for applicants will begin during February, including efforts to collaborate with the 2 other cities for rollout dates. And application processing will begin starting March 15th. This concludes my update. Now please welcome Melanie Shelton. Thank you.
Thank you, David. Chair Fletcher, members of the board, after hearing from a panel of economists and experts on the overall economic health of the San Diego region last year, the San Diego Association of Governments, or SANDAG, has continued to provide updates to share with you on COVID's local economic impact. This dashboard has remained roughly unchanged with 2 notable exceptions. First, foot traffic, which is a measure of the number of people visiting certain areas like restaurants, cafes, malls, parks, and libraries, is down 36%. That's 6% worse than the report presented last month. This shows the latest stay-at-home order and the increase of COVID cases have compelled more people to stay home than go out. The second metric I'll point out is our regional consumer spending. It was down by 5% as compared to October, or 12% overall since the pandemic began. And again, airport travel is down significantly. The hardest hit sectors in terms of job losses are tourism, retail, and education. And we're expecting a $10 to $15 billion loss in gross regional product for 2020, similar to what was just experienced during the Great Recession in 2009. A full update on the county's financial position for the second quarter will be presented to your board in March. And as a primer to that, we'll discuss a few indicators here today in the next few slides. A key metric that we use to diagnose the health of the economy is the unemployment rate. Just released a few days ago, the December unemployment rate in San Diego County was 8%, which is above the 6.6% rate reported in November. This slide shows a change in employment for differing income levels through the end of October. The dark line at the top represents those who make over $60,000 per year. The light green line represents income levels between $27,000 and $60,000, and the blue line shows individuals making below $27,000. You can see that the top income bracket has actually experienced a 1% job gain compared to when the pandemic began. The middle income bracket here underwent a 7% drop in employment, and the lowest income bracket, or the blue line, suffered an alarming 24% change in their employment. This chart seems to suggest that 1 in 4 at the lowest income level, or those who have jobs that likely do not require a college education, still find themselves unemployed. Just viewing unemployment trends from a slightly different angle, let's look at some of the hardest hit sectors. When we first presented this slide to the board in the fall, there was only 1 bar per sector, and now in this chart there are 2 bars. The orange bar represents job losses from the start of the pandemic through May, and the pink bar represents job losses from the start of the pandemic through November. Where the orange bar is more negative than the pink bar, as in tourism and retail sectors, we see job losses recovered through November. Where the orange bar is less negative than the pink bar, as in the education sector, we see additional job losses. In the construction industry, we actually see the pink bar trending slightly positive, which is a good thing. This means that San Diego has regained all the job losses due to the pandemic, but these sectors have realized gains. Overall, it seems that there's some recovery happening, but these numbers don't include the latest stay-at-home order, so we'll continue to monitor this metric very closely. As previously discussed, foot traffic, which measures the movement of people to places in the community, is down, but it also signals some degree to how much people spend, which is what you can see here in these 2 charts. Experts estimated that foot traffic was down between 22 and 25% during the holiday period. And with that said, the amount of time that someone spends at a business and the correlation to spending money creates an important point for the next slide. This slide here depicts the activity levels of San Diego businesses as a percentage of their activity just prior to the first stay-at-home order in March. Each category of business shown here, with 2 exceptions, have taken a similar roller coaster ride in terms of activity over the last year. And you can see the trends and the drops in activity levels here on that slide. The 2 business categories that did not follow this trend were hardware stores and auto repairs. The first contrasting category, hardware stores and its teal line, should not be a surprise, given the boom in construction and the fact that people are working from home and perhaps resurrecting their overdue projects. Hardware store activity and sales are up higher than the rest of San Diego businesses. And then second, auto repairs is the other business category that didn't follow the normal trend, and that's the light gray line, which narrowly trends positive from August through October. This anomaly also makes some sense as people were staying home. They didn't use their cars as much and the roads were mostly empty. However, when employees started going back to work, they could no longer put off their necessary car repairs, leading to an uptick in the auto repairs category. In closing, many experts believe the recovery is going to be defined by businesses adapting to their new operating environment. Some sectors may be fortunate and experience little to no change due to COVID, but for most sectors, they will need to innovate and fine-tune to fully recover. For our part, staff looks forward to working with the business community to make the recovery as successful as possible. Back to you, Don.
Thanks, Ebony. In addition to receiving this update, we recommend your board take the following additional actions with respect to this item. First, ratify all actions previously taken in response to this local health emergency and local emergency. Specifically, these ratifications include contracts with the following healthcare systems for vaccine distribution: Sharp Coronado, signed on January 13th. Sharp Grossmont, signed on January 15th. Rady Children's, signed on January 15th. Family Health Care Centers of San Diego, signed on January 16th. And UCSD, signed on January 21st. Additionally, this ratification includes a contract with the private company HEAL. HEAL has received state approval to distribute vaccines as needed and also contracted with other counties in California. Given their model of service, which provides in-home service that is especially critical for homebound individuals, including seniors, we plan on using HEAL as yet another staffing agency to support increasing our vaccination workforce numbers. And finally, the recommendation, take any other action necessary to address the COVID-19 pandemic emergency response. Subject to your questions, this concludes our presentation.
Thank you. I want to thank the staff for that presentation. I suspect we're going to have extensive board comments and questions. If it's okay with board members, if we go to public comment, hear from the public, and then we can all begin our process. If there's someone who has a pressing item that they would like to address before we do public comment or a direct question to staff, we can do that. Supervisor Desmond.
Yeah, thank you, Mr. Chair. I just have a few questions, and then I'll have to save my comments till after the public input. But I have first a question for Dr. Martin. Is the vaccine that we're now getting, does that also work on that B117? And you might have said that, but I just want to get a clarification. So I'm just wondering if the vaccine that we're taking now is effective against that new strain.
Yes, thank you for that question. So the evidence that we have is that the vaccine is effective against the new strain. You may have seen some discussion reported in the press about other variants that potentially the vaccine may be slightly less effective, but the vaccine across the board is still effective against all of these variants, and so we need to focus on expanding the vaccination as much as quickly, again, to reduce the likelihood of these new variants arising.
All right, that's great news. Thank you very much. Then I have a question for Ebony Shelton. You said that the unemployment rate is 8% in San Diego County. I'm just trying to put that into numbers. I don't know if that's 8% of the workforce, 8% of the population. I guess I remember last time we had this presentation, there was roughly 200,000 people in San Diego County who were unemployed. What does that 8% represent, I guess, number-wise?
It's down. We're down approximately 105,000 over the last year.
Okay, so we're 105,000 people in San Diego County. That represents the 8% unemployment?
That's right.
Okay. And then just, again, one more, Mr. Chair, thanks for indulging me here for the questions. For Mr. Mascione, I'd love to see all the testing stations coming up online, but I'm getting calls from Borrego Springs, I'm getting calls from Valley Center, I'm getting calls from remote areas of San Diego County that, we have a lot of seniors, 75-plus-year-olds that are taking the drive as almost as threatening to them as the virus. So I'm just curious what Borrego Springs and people like that can look forward to.
Thank you, Supervisor Desmond. For those that are in homes that may have a long-term care facility, they already may be covered by CVS or Walgreens. But to your point, just like we did for T3 on testing, it is indeed the approach we're using with CAL FIRE to go out to our rural towns and communities to do vaccinations. That is underway. That schedule is being built. And so we will be rotating our paramedics that will be doing vaccinations throughout the different communities as we've done for testing.
Well, I appreciate that, but when we contacted Chief Meacham and CAL FIRE, they say we're waiting on Behavior and Health and Human Services. So you say you still have that plan in work. I guess what I'm trying to do is give some news to my people in Borrego Springs.
Let them know vaccines on the way.
Okay. And the next question I'm going to get is when, but I know you probably don't have that. But thank you very much for working on that effort.
Thank you. Thank you, Supervisor. Any other board members with pressing questions for staff before we go to public comment? All right, seeing none, I know we have a number of speakers who wish to speak, so I will ask the clerk to call those members of the public who wish to comment on this item. And then after that, we will return to board members.
Thank you, Chair Fletcher. Any members of the public that have requested to speak on this item, please dial into the conference line now using the instructions provided to you. I'll note for the record that we received 6 e-comments on this item, and we have 31 requests to speak. We'll be calling speakers by the last 4 digits of their phone number. You'll hear notification that your call has been unmuted. You will then need to press *6 to unmute your phone. Each caller will be asked to state their name for the audio record. You will have 2 minutes to address the board. You'll hear this sound when your time is up, so please conclude your comments at that time. And I would remind the public speakers that they should mute their TV or live video stream before they begin speaking. Aaron, if you could please identify the first caller.
Yes, thank you. Our first caller is 6789. 6789.
Hello?
Hello there.
Can you hear me? Hi, can you hear me?
Yes, we can hear you.
Hi, my name is this for item 7? This is correct, right?
Yes, this is correct. It's item 7, COVID.
Thank you. So my name is Patricia Mendoza. I'm a member of ACE, and I lived in the city of Imperial Beach approximately 4 years. Before that, I used to live in National City. And I'm calling today to urge you to invest $100 million for the rental assistance for tenants who have not been able to pay the rent due to COVID-19, like myself. And to make sure that the help is available for all tenants, regardless of their immigration status. You know, it's really sad to where we can't help everybody, but everybody lives here. Everybody is a community. I'm just gonna say, I met Nathan Fletcher, I believe in September or October, I believe. And you met my 17-year-old daughter, and you met my 10-year-old boy. And I know that they're with you guys. You guys may come into a lot of disagreement or a lot of agreement, but the last words my kids heard from you was hug it out. Whenever you have an issue or a problem, you would hug it out. And I pray that now during these horrible times, because I lost my job since March of 2020, and I have not been able to return to work. And I have to depend, you know, my kids depend on me. They're my responsibility. And with that being said, I just pray that all of you up there making these decisions for us, please hug it out. Hug it out and know that your people right now, we really need you. We really need you more than ever. Thank you so much.
Thank you. Our next speaker is 0308. 0308. Please press *6 to unmute yourself. 0308. If we don't hear from you when your number is called, we will come back to you. Our next speaker is 5700. 5700. Again, if we don't hear from you, we'll come back to you.
Hello, can you hear me?
Hi there, yes.
Hello? Yes. Hi. My name is Zhang Wei. I'm an organizer with CPI. I'm speaking on the item 7 regarding the $48.8 million of federal funding for rental assistance. I appreciate the fact that there are money allocated for rent relief, but there isn't publicly available information on how the money will be distributed. There need to be transparency and clarity about this program. I also want to take this moment to encourage the supervisor to please look at the last round of rental assistance for learning lessons and see how you will be rolling this program out with an equity lens. We should consider the impact of folks on the front, the undocumented immigrants who have been blocked from most governmental supports or program, and the non-English speaking immigrant community who are often blocked out for not getting the information soon enough because of the lack of language translation in your outreach. I am advocating for a thoughtful process to ensure the folks who are most impacted but often ignore to have equitable access to this rental assistance support as they are also our community members. Thank you.
Thank you. Our next speaker is 5114. 5114.
Good morning. My name is Consuelo Villalpando, and I'm also a member of ACE. I live in Imperial Beach also. And the reason I'm calling is to, it just was heartbreaking to hear one of the other members of ACE, which is Patricia Mendoza. We have been behind her for all the things that have been happening to her. It's very sad about what her family is going through. And I'm here to urge you actually to invest more money. I don't think there's enough money for what you just have planned for, the people who cannot pay rent right now. As a matter of fact, I feel that it should be another type of how to resolve this issue. Right now we need it. People needs it. And if we help people right now that needs it, I think we can come up with other programs that we can help return that money in a way once everything settles down. But right now, the people cannot be evicted, cannot be in the streets. It's family. People doesn't have any papers. It's being human. And I feel that don't do to others what you don't want to do to you. Put yourself in our shoes and the people that need. And I was a department manager for a long time, and I know how the landlords behave, how they don't care. They care about just the money. I was in this business for many, many years. The last time I was in there for 16 years, and I knew I had to balance between the landlord and the tenant because the way they only think is about their money in their pocket. So please just consider everything that's going on right now. We don't need people in the street. We don't need people being homeless. We don't need people, knocking at the doors. It'll come out more crime. Something bad will come out of this if you don't help the communities that need it right now. Thank you very much for listening to me, and God bless everybody.
Thank you. Our next speaker is 8576. 8576.
Hi, my name is Valentina. I am a member of ACE and I live in the city of San Diego. I am calling today to support Patricia and so many other residents of, San Diego County because I know that we've been talking about the impact of COVID, but it really hits close to home when it's your neighbors and your family that are being affected. And especially, nobody should have to choose between going to work, getting sick, to have to pay rent and have a safe place to stay home and shelter in place. And I'm urging you all to please vote and just give our residents more rental assistance and, do the best that you can for tenants because it's a hard time. And as another caller previously stated, a hard time for a lot of people and especially undocumented communities and our most vulnerable populations because, like was mentioned, they're barred from government resources and aid. And these are our essential workers. These are the people that have pushed through and have been on the front lines and have put their life on the line. And to not have any assistance or to have 25%? I don't even know, but it's not enough. And I'm really urging all of you to please, provide the support that our residents need in this time. I just want to thank you for listening to us, but I really hope that you all actually vote to do something about this today. Thank you so much.
Thank you. Our next speaker is 3083. 3083.
Si puede apretar asterisco 6 para poder hablar.
¿Me escucha?
Sí, adelante.
Sí, buenas tardes. Mi nombre es María Flores.
Good afternoon. My name is Maria Flores.
Vivo en la ciudad de Vista, California.
I live in Vista.
Soy una miembro de ACE.
And I am a member of ACE.
Estoy llamando, ¿verdad?, para que pedirles de favor que inviertan más para la ayuda de la renta.
I am calling to ask that you please invest more into rental assistance.
ya que muchas personas, incluyéndome a mí, hay muchas personas que han perdido sus empleos y no es causa de que uno quiera, es porque la pandemia, ¿verdad?
Because many people, including myself, have lost our jobs, and that is not because we want to, it's because of the pandemic.
Yo en la ciudad de Vista, en agosto, se abrió una ayuda de la ciudad para aplicar para la renta y hasta hoy, enero 26, no he tenido respuesta y no se me hace justo, ¿verdad? Que es algo que está necesitando toda la comunidad que no ha podido trabajar desde abril que empezó la pandemia.
For example, in the city of Vista, in August, they opened the rental assistance applications, and today, January 26th, they still not had any answer. And I don't think that that's fair, and it's really needed in our communities. Many of us have not been able to work since April when the pandemic started.
Otra de las cosas para los caseros, también necesitamos que alguien o haya una ley que también les digan que no se tienen que poner, que no quieren recibir la ayuda de donde venga, ¿verdad?
The other thing is that there should be a law for landlords that says that they have to receive the aid regardless of where it is coming from.
Muchas gracias y gracias por escucharme.
Thank you, and thank you for listening to me.
Thank you. Our next speaker is 3583. 3583. Please press star 6 to unmute yourself. And if we don't hear from you when your number is called, we'll come back to you.
Hello. Good afternoon. My name is Anais Alegria. I'm a member of ACE, and I live in the city of San Diego. I live in District 1, and I am calling today to urge you to invest more money in rental assistance for the tenants. Hundreds of individuals have been unable to pay for the rent due to COVID, and my community really been hard hit by this. We have had a lot of working families that can't go to work for multiple reasons. And so this financial assistance should be made available for all tenants, regardless of their immigration status. Because again, my community is an amazing community, and I wish they had more help. And I hope that this rental relief is distributed equitably. That is all. Thank you so much for listening to us, and I hope you side with us. Thank you so much.
Thank you. Our next speaker is 9713. 9713. Please press star 6 to unmute yourself. And again, if we don't hear from you when your number is called, we will come back to you. Our next speaker is 9483. 9483.
Hello, good afternoon. My name is Christian Mejia. I am a member of ACE, and I live in Chula Vista. I'm calling today because I have a major urging I really need to urge to you that whatever rental assistance program that exists is great, and we really appreciate it, but it needs to be scrapped and needs to be doubled, tripled, quadrupled. We're living in an unprecedented crisis, and people haven't been able to pay the rent. And you might be asking, where are we going to find that money? Well, I mean, tax the rich for all I care. You could ask Daryl Issa, a man that has a net worth of $283 million, has plenty of money to spare for the people who we need it. And so as the Board of Supervisors, I urge you to, see for the collective health of the community. and not just be, because as we are moving forward, we can't be expecting that we're out of the loop with the ending of the stay-at-home order, and we're asking people to be able to go out and support small businesses and go out in the economy and go to work when they're still putting themselves at risk. Everyone who feels like that they're at any sense of risk from this crisis should not have to feel any type of economic or legal pressure to put themselves in an endangered situation. And I just really want to press that forward onto you. Please take responsible action. Thank you.
Thank you. Our next speaker is 3017. 3017.
Theo Hansen, thank you guys. I thought that everyone prepared well for today's presentation. I wanted to acknowledge that. I felt that it was very professional. It was very thorough, and it goes along with my request. It feels like the state of California as a whole, though, has not had that same transparency that perhaps you guys are willing to do. And I'd love to encourage you to do that and to allow access for those who'd like to question it from a scientific perspective. Specifically, the model for the B1.1.7 variant and for those predictions. Also, I'd ask that you would keep and tally and report on adverse reactions to any and all of the vaccine programs, bearing in mind that we're actually dealing with at least 2 different vaccines right now, whether it's Pfizer or Moderna, and looking also at their efficacy. And we'd like to know that also by specific vaccine as well. And then most importantly, I think, is asymptomatic transmission. I'd love to see what science, if you would present that to us and let us be able to question that. What science is leading this decision that healthy people have to be masked and that we have to shut down in the method and manner in which we have. It sort of seems that we've just said, well, whatever the CDC says goes, but the CDC hasn't actually cited anything. And one of the largest studies that was being respected for that was recently retracted. So I would ask that you would do that. And then as you continue to make decisions as to where to spend resources, I'd ask that those be focused on the most at risk, and we look at strategies that would include things like home delivery, ready-to-eat meals, health orientation, health education. We continue to see people that are obese are hospitalized 300% more often, and we know that hospitalizations equal fatalities. So again, thank you for all that you do, and I'm just a little bit surprised that we have, while I see the need, such a willingness to focus dollars on people who haven't taken a legal process to be here, while we have those who are suffering, who we're using their tax dollars. So as much benevolence as we might all be drawn to, I'd encourage us to remember that these are legal American citizens who have been taxed. This is their tax dollars being redistributed back. So thank you for all that you do.
Thank you. Our next speaker is 5362. 5362. Please press *6 to unmute yourself. And again, if we don't hear from you when your number is called, we will return to you later. Our next caller is 6474. 6474.
6474, oprima el 6 para poder hablar. Asterisco 6.
Buenos días, Misita.
Sí, adelante.
Sí, buenos días a todos. Mi nombre es Ramón Toscano y soy de la ciudad de Vista, California.
Good afternoon to everyone. My name is Ramon Toscano, and I am from Vista, California.
Soy miembro del grupo ACE y vivo en la ciudad de Vista.
I am a member of ACE, and I live in Vista.
Estoy llamando hoy para pedir que inviertan mucho más dinero para ayudar a los inquilinos que no hemos podido pagar la renta debido al COVID-19.
I am calling to ask that you invest a lot more money, to help in rental assistance for tenants that have not been able to pay their rent due to COVID-19.
Y también mediante este mensaje también les quiero pedir que esta vez se aseguren que la ayuda llegue a toda la gente, ¿me entiendes? Porque han salido ayudas y todo el tiempo personas como yo que no tenemos papeles nos quedamos como los chinitos nomás mirando que distribuyen ayuda.
I would also ask that you make sure that the rental assistance or any assistance reaches everyone, because oftentimes people like myself that are undocumented just are standing around watching as other people are able to receive assistance, but we are not able to.
Porque pareciera que nosotros los latinos o los filipinos o toda la gente que no tiene papeles no estuviéramos en la pandemia. O sea, también nosotros somos afectados, no nomás la gente de un solo color.
It would almost appear as if Latinos or Filipinos or other undocumented persons are not as affected by the pandemic, but we are, and it's not just one color that's affected.
En lo personal, como dicen mis otros compañeros, también nos ha afectado mucho porque hemos perdido trabajo y no hemos podido pagar la renta. También quería pedirles que asesoren a los managers o a los dueños para que ellos sepan que estamos en una pandemia y no estén como hostigando a la gente a que les pague, sabiendo que la gente muchas veces no trabaja o ha perdido trabajo.
Myself and my coworkers, a lot of us have lost our jobs. We haven't been able to pay rent. I would also ask if you could provide some sort of guidance for managers or landlords to let them know that it's not okay to be harassing people, that we aren't paying rent not by choice, but because we have lost our jobs and we're all in the pandemic.
Y también ya por último, ya le quería pedir que por favor para las próximas meetings o las próximas juntas o por favor que lo puedan hacer en español para que así podamos entender muchas personas como yo que no entiende mucho inglés, que no habla mucho inglés, que podamos entender todo lo que están hablando, ¿me entiendes? Y muchas gracias y contamos con su apoyo.
Lastly, I would ask that in future meetings or in the next meetings, if you could conduct them in Spanish so that we could understand everything that is being said and everything that you are discussing. People like myself that don't speak fluent English struggle to understand, so I would request your support for that ask, and thank you very much.
Thank you. Our next speaker is 7612. 7612.
Hi, Amber speaking. I would like to start off thanking Jim Desmond for opening schools, businesses, voting no on 7. Shame, excuse me, on Fletcher and Wilma. We know that flattening the curve didn't work 8 months ago, and it still doesn't now, and that after 35 PCR test cycles, you get a 97% false positive. We know that people are being injured and dying from vaccinations. We know that the Petco Park was shut down for a day due to allergic reactions. We know that Hank Williams, the baseball player, has died. We know that the safety and efficacy have not been tested thoroughly. We know that we are being desensitized and programmed and herded like cattle. I will not tolerate my family, my peers being discriminated and desegregated against based on a scandemic, a pandemic, to track and digitalize DNA in the financial footsteps of we the people to become slaves to the elite bankers. The compliance and enforcement process is against the Constitution. How dare you shut down the small businesses and jobs? What a waste of money and time. Let me finish off by saying I am a resident of Pacific Beach area, Claremont. My name is Amber Gillis. I am a resident that is governed by the law and not criminal edicts. You have all stepped outside your limited authority and purged your oath. Your unconstitutional actions are an act of domestic terrorism and will not be tolerated. You are constitutionally required to step down immediately or we will have you arrested. The authorities have been informed. You have limited your authority and trespass on my God-given rights that are guaranteed to me under the Constitution. You willingly and knowingly purged your oath and have been served. You are required to step down from your positions and demand your arrest.
Thank you,
I'm a law-abiding citizen, and you have caused harm to me, violated due process, and purged your oath to the Constitution that guarantees my unalienable rights.
Thank you, ma'am.
Thank
Your time
you.
is up. Thank
Your
you.
time is up. Our next speaker is 0805. 0805. Oh, yes, 0805. 0805. And oh.
Hello. Can you hear me?
Yes. Hello there.
Hi. This is Vanessa. I am a member of ACE, and I live in the city of Chula Vista. I'm calling today to urge you to invest $100 million for rental assistance for tenants who have not been able to pay their rent due to the COVID-19 pandemic, and to make sure that the help is available for all tenants, regardless of their immigration status. I know that large corporations are getting bailouts. I think it would be wise to also invest in our communities and keep each other safe. So thank you for your time.
Thank you. Our next speaker is 2480. 2480. 2480, please press *6 to unmute yourself.
Hi, my name is Patricia Duran, and I also am a member of ACE. And I work as a community family liaison, and I serve families from North County, Vista, San Marcos, San Diego, and the South Bay Chula Vista National City. So I really rely on the county to do the rental assistance program, because I know that takes it to the limits of everywhere for everybody to get rental assistance. I know that there's 42 million available, but if we could have more, that would be greatly appreciated. I do talk to families every day that this is affecting, and the county rental assistance that was already given has helped a lot of families. The county rental assistance program has been great and an easy application compared to the city one. I am very appreciative of what you've done for some families, but there's still families out there. We're still in a pandemic, and there's still a lot of families that need their rent paid and their landlords not to harass them or hassle them. And once again, I count on you, because I know the county can come through for this. And, you know, I did hear a speaker earlier talk about undocumented don't deserve it, that you need to legally be here. There are some people that were in the process before the pandemic and have not been able to do legal, and they've been punished for that. So people shouldn't judge people unless they're in their shoes. And I've been here and seen people undocumented work their butts off. So to me, it should be open to everybody. And I really urge you to make the right decision and put a lot of money to rental assistance so that we can keep our economy moving, people comfortable, getting people back to work. And, you know, I appreciate everything you guys do. Thank you so much.
Thank you. Our next speaker is 7872. 7872.
Hello?
Hello.
Hi, my name is Allison Hartman, and I'm calling today because I have a lot of concerns with the County of San Diego's response to the COVID crisis. My biggest concern is that there's been zero transparency with all of the data that we are being locked down with. We know that cases do not even equal symptomatic people, nor infections, nor deadly infections. We know that the World Health Organization just recently had an issue with the PCR testing and had them reduce the cycles. So does that mean that all the positives that you guys used to lock us down with could have possibly been false positives? My next thing is, we're talking a lot about equity recently, and I am definitely a proponent of anti-racism and equity. But how is it equity when most of the callers on this issue are begging for rental assistance? I don't think that these people come from the rich neighborhoods of San Diego. I could be wrong. I personally, as a single parent, had to quit my job to stay at home and homeschool my kids, and I'm trying to figure out, how the heck am I supposed to work when I have kids at home all day that I'm also schooling? This is unacceptable, absolutely unacceptable. We demand transparency with the data, and we're going to get it soon. And if we find out that any fraud was perpetrated, then you're going to have to answer to the people of San Diego. This is unacceptable. You are leaving our most at-risk, most vulnerable populations to languish and suffer, while people like the Board of Supervisors have had their salaries this entire time and are very comfortable. The next thing is you need to meet in person because the people need to be at these meetings. This is our community. Our voice needs to be heard in person. This is unacceptable behavior for a governing body, and you will be held to account.
Thank you. Your time is up. Thank you.
Our next speaker is 0945. 0945.
Hello, my name is Renee Keister-Wellman. Good afternoon. Hello, Chairperson Fletcher and Supervisors. I am a member of SEIU Local 221, and I have worked for the county as a protective services worker for almost 30 years. I work at Child Welfare Services to keep the public safe by investigating allegations of child abuse and neglect. Protective services workers go into homes, interview children and families. They conduct these interviews face-to-face, evaluate the safety of the homes, and make determinations as to whether additional interventions are warranted. I urge the county to support their workers and make sure that all workers receive the COVID vaccine. Many of my fellow protective services workers have come down with COVID. Some have become very sick, and one has died. Please respect your workforce, keep us safe, and make sure we get immunized in the very near future. Thank you for your time.
Thank you. Our next speaker is 9719. 9719.
9719, oprima asterisco 6. Adelante.
Sí, muy buenos días a todos supervisores y traductores.
Good morning to all, Board of Supervisors and translator.
Les quería pedir, mi nombre es Javier Parada, y les quería pedir por favor que si podían invertir $100 millones para los inquilinos.
My name is Javier Parada, and I'm calling to ask that you please invest $100 million for rental assistance and tenants.
Porque la verdad todos las estamos pasando muy mal en esta pandemia, ya que no hemos podido pagar nuestra renta.
The truth is we are all suffering a lot during this pandemic because we haven't been able to pay our rent.
Y ya que, pues, la verdad, todos estamos siguiendo las reglas de estar en casa.
We are all following the rules of staying at home.
Y queremos que, por favor, inviertan este dinero, ya que todos lo estamos ocupando, incluyendo inmigrantes indocumentados.
Now, we ask that you please invest this money because we all need it, including undocumented immigrants.
Ya que inmigrantes indocumentados han sido desplazados de varias ayudas, tanto como de San Diego County, nos mandan para un lado, nos mandan para otro, y ya no nos aprueban en ningún lado, como que es un juego para ellos.
A lot of undocumented immigrants, we have been displaced and not been able to receive assistance from a number of places, such as San Diego County. Sometimes we're sent to one place and then another and another, like it's a game.
Y la verdad, no estamos para un juego, estamos para que nos ayuden, porque estamos pidiendo esta ayuda porque la necesitamos, no nomás por pedir.
The truth is, this isn't a game, and we need the help. We are asking for help because we need it, not for any other reason.
Y es todo, la verdad, pienso que por favor tengan un poco de compasión de dar ayuda para todos, incluyendo inmigrantes indocumentados. Lo vuelvo a repetir, inmigrantes indocumentados.
That's all. I think that it's very important that you have some compassion and that you help everyone, including undocumented immigrants. I'll repeat it, including undocumented immigrants.
Muchas gracias y por favor esperamos una respuesta.
Thank you, and please, we would like your answer.
Thank you. Our next speaker is 0308. 0308.
Hello, my name's Christy, and I'm a member of ACE and live in the city of San Isidro. And I'm calling today to urge that you invest a lot more money as well for the rental assistance program, because a lot of tenants still haven't been able to pay due to the pandemic, and make sure that all help is available also for undocumented people, just because undocumented people are actually people who build our community, so they should not be discriminated during these times. So hopefully we can count on your support. Thank you.
Thank you. Our next speaker is 9713. 9713.
Hi, good afternoon. My name is Eduardo, and I am a member of ACE and a lifelong resident of South Bay here in San Diego. I'm calling today to mirror what a majority of the people here, not everyone. Some people have different priorities, but I'm here to urge the county supervisors to invest into a non-means tested. I repeat, do not make this rental assistance means tested so it can be accessible to undocumented folks, people that may have some employment but are still struggling, but there needs to be more assistance for the people that are leaving for dead. So in this pandemic, the coronavirus and evictions is akin to death. So please invest in your constituents, invest in your community, and invest in the most vulnerable. Thank you.
Thank you. Our next speaker is 5362. 5362.
I think it might just be you and I. Sandra's heading up LA.
Hi, good afternoon. My name is Judith Howell, and I'm calling on behalf of Planned Parenthood of the Pacific Southwest and the Invest in San Diego Families Coalition. Any rental assistance should be equitably distributed and reach the most impacted people. We are already experiencing a high amount of people living on the street. Not funding additional money for rent relief will severely impact the future health and well-being of our community. Every week, I'm personally seeing new people on the streets, people sleeping in their cars, young people, families. Prioritizing additional funds for rent relief will keep families safe and will prevent an uptick in people experiencing homelessness. Rent relief should include everyone, no exceptions. Undocumented families have been among the hardest hit by the pandemic and have been excluded from most rent reliefs. We need to support all people living in San Diego County. Thank you.
Thank you. Our next speaker is 6631. 6631.
¿6631 oprima asterisco 6 para poder hablar? 6631.
This is our last speaker on this item.
$6631. Si gusta hablar, por favor, oprima asterisco 6. Última llamada para el 6631.
Chair Fletcher, we're not getting a response from that particular caller, and that was our last request to speak on this item.
All right, thank you, Aaron. I want to thank all of the callers who took time to call in and join today's meeting. With this, we'll go to board member discussion and deliberation. Obviously, the situation surrounding COVID remains a very serious one. We have seen encouraging signs in the recent days. The Southern California ICU projections moving beyond that of 15% for the next 3 to 4 weeks, which is what allowed us to leave the regional stay-at-home order and return to the purple tier. That matches some case evidence and a decline in the number of cases, as we saw in Dr. Wooten's presentation. But we are mindful that although now is the time we are beginning to move forward with more reopenings, it's not a time when we can lose our vigilance or our focus. As Dr. Martin and others shared, there is considerable concern about the presence of a potentially more contagious strain. And so we have to be mindful that while we are encouraged and are taking steps in a good direction, we really have to continue to each adhere to the guidance and the broad strokes that are out there so that we can keep that trajectory going down. If we stay safe, we stay open, and we stay on a positive direction, and we can hopefully end the boom-bust cycle while we simultaneously focus on vaccine administration, a process that is fraught with uncertainty in terms of how many vaccines we will get, when they will arrive. But we are certainly doing everything possible to get our county in a position to administer significant dosages and make it available as they come forward. And so I think we obviously have a ways to go in terms of what we need to do. But with the arrival of the vaccine, with the recent decline in cases, folks should feel like if we continue doing the things we're doing, we're headed on a pathway to come out of this. We have a number of items that I know board members will want to weigh in on that we have to consider today in adopting the totality of the recommendations put forward. I just want to make one comment on rental assistance, and then we will go to my colleagues and hear folks' thoughts, and then arrive back in an adoption of the recommendations. But when it comes to rental assistance, one of the most challenging things of COVID has just been a consistency of approach and sharing information. Rental assistance funds went to the city of San Diego for them to administer for their residents in the city of San Diego. They went to the city of Chula Vista for them to administer and run for residents of Chula Vista. And then the county of San Diego received funds for everyone else in the county, the individuals in the 16 other incorporated cities, as well as those in the unincorporated areas. And I think it's vitally important that we coordinate the rollout of this rental assistance program with the city of San Diego and with the city of Chula Vista, so that regardless of where they live, there's a consistency in the three programs as best as possible. And when they are rolled out, there's an easy portal for any San Diegan to go to and see, if you live in the city of San Diego, click here, city of Chula Vista, click here, anywhere else, click here, so that individuals can access the program that is appropriate for them. If we don't do that and we have three conflicting programs rolled out at different times, it will create significant confusion. But with that, let's go to our colleagues. I will, to get the conversation started, I will put a motion on the table to adopt the three recommendations, receiving the update, ratifying all actions taken in response to the local public health emergency, and three, take other actions as necessary to address COVID-19 pandemic emergency response. So put a motion on the table for discussion purposes to get us moving. Is there a second to that initial motion?
I'll second that motion.
I have a second by Vice Chair Vargas. With this, we'll go to board member comments. Vice Chair Vargas, we'll start with you.
Thank you, Chairman Fletcher. I wanted to really take some time to begin to acknowledge and thank county staff for all their hard work on these COVID efforts. I really want to thank them for all the work that they're doing and the support and responsiveness that they've had when working, particularly with my office. Now with the vaccine distribution efforts underway, my priority has really been to focus on ensuring that the vaccination process is an efficient one and accessible, making sure it's accessible to all those folks in our community who are eligible at this time. I recognize that for some individuals, especially our older populations, it could be challenging to make an appointment. Some folks do not have access to technology, there's a language barrier, etc. Quiero solamente comentar a todas las personas que están con nosotros, y lo quiero hacer en español porque creo que es importante que las personas sepan que el Condado de San Diego está trabajando día y noche para poder tomar esta información que las comunidades necesitan ahora que estamos tratando de enfocarnos en que la gente tenga acceso a las vacunas. En realidad es muy difícil porque todavía falta pues que la gente tenga acceso a tecnología, etcétera. Entonces quiero que sepa la gente que estamos trabajando con el condado para poder que la gente tenga acceso, ¿no? So I wanted to make sure that that folks understand that we are aware of some of the challenges and our teams are collaborating with the county staff I know that we just sent a 2-page memo to Health and Human Services with a lot of direction of some concerns that we are hearing directly from our communities. And I hope that we'll be able to provide some additional information quickly on how we're resolving some of these matters, including issues around transportation and access to get appointments. Additionally, I do believe that everyone needs to play their part during these challenging times, and I want to give kudos to UCSD, Sharps, and Scripps for the critical work that they're doing and their partnership that they've created with so many of us. I went to visit the pod in Chula Vista, both when we open it up and then on Sunday, and their flexibility and the work that they're doing is exceptional. The vaccines that are being received by the county, providers, pharmacies, et cetera, I think it's there's a lot of confusion for folks, and I think we're going to continue to make sure that people understand what their process is. I recognize that for providers, you know, some of their members are still confused about where they go, and we're going to continue to push that information forward. So I think it's important that we figure out a reimbursement process to ensure that costs are shared appropriately, as I know that we continue to, you know, meet the needs to ensure that everybody is vaccinated, but it's hitting the county hard. All this to say that we all need to work together to move forward with our efforts. I know that there are providers in the county that have already stepped up to the plate and are working diligently, so thank you for that. And to those partners who have not engaged with the county, I look forward to establishing those partnerships to continue to work. I also want to acknowledge the concerns for making the rent relief assistance program accessible to everyone, regardless of immigration status. And I'm going to continue to work with county staff to address some of these concerns. I wanted to thank you for this. I will be supporting this, but I do want to say to the, in Spanish, just really quickly, a todos los señores de ACE que nos acompañaron ahora, muchísimas gracias. Lo que voy a hacer en los medios sociales míos es darle la información para que sepan en dónde pueden escuchar la Junta de Supervisores en español para que tengan esa información directamente, pero estamos a sus órdenes. Toda la información que ustedes nos han dado la estamos anotando y vamos a trabajar con ustedes. Muchas gracias. Thank you, Chair.
Thank you, Supervisor Vargas. I will now go to Supervisor Lawson-Remer.
Hi, thank you very much, Chair Fletcher. And I just really want to, first I have a lot to say. This is obviously the crisis facing our community at this time. And I want to begin by acknowledging and thanking Chair Fletcher and Vice Chair Vargas for all your thought and leadership on our subcommittee, on our COVID subcommittee, and bringing forward this work, as well as county staff. That report was extensive and impressive and full of data and very, very helpful, hopefully for our entire community and certainly for me as well. With a new president in the White House, I'm definitely feeling hopeful about our future and our ability to overcome this COVID crisis, and particularly with President Biden invoking the Defense Production Act to ramp up the vaccine production. And we certainly have to act with similar urgency here locally to ensure we can quickly administer vaccine doses once they become available. I mean, the clear reality, I think that was helpful to articulate that in the report, is that we have not received nearly enough doses to meet the need for everyone who is eligible. But simultaneously, it is clear we must be ready to act as doses become available in the coming weeks, as this is the safest way to get our economy back on track and our schools reopened. And that's why I've been working hard to open vaccine superstations and pods in my North County district, from coast to inland. So again, I want to thank Chair Fletcher and Vice Chair Vargas for your leadership. And with that, I do want to focus my remarks on the rental assistance issue, given that this was such a significant focus of comment from the public. There's no question that housing insecurity is an acute need at this time, and rental assistance is essential. I think $48.8 million is a good start, and I agree we need to move immediately to approve this program. In my district, Escondido has some of the most vulnerable communities on our entire county. And I very truly applaud the work that's been done by staff to build equity into the rental assistance program. With that in mind, I'd like to highlight a few important considerations to ensure fairness and equity to bring relief to those most severely impacted. I also have a few questions, additional questions for staff, and 3 potential amendments to propose for discussion. Just want to overall support the staff recommendations and the leadership of Chair Fletcher and Vice Chair Vargas regarding the geographic structure of the rental program to ensure equity across all of our cities in our region. I think that is thoughtful. And I want to echo and build on Chair Fletcher's comments regarding creating a portal that's streamlined, that people in all of our different cities can access, whether you're accessing the county fund or the San Diego fund or the Chula Vista fund, that folks who are in need across our entire county will have a same chance to receive access to vital rental assistance and can do it in a way that's streamlined and doesn't create confusion with a bunch of different portals and a bunch of different fund points of entry. So I think that's a thoughtful approach. I also want to echo the input of many of our callers that we need to work closely with our community-based partners to ensure targeted community outreach, especially to vulnerable populations like seniors, people with disabilities, and across a diversity of languages. And I third would like to just take a moment to acknowledge the importance of the health equity framework that prioritizes communities with long-term structural inequalities. I appreciate the thoughtfulness of approach, and I want to just take a moment to note that it's absolutely vital that this type of analysis is disaggregated at the census tract level. It, for the purposes of this proposal, it is disaggregated at the census tract level. That's really important so that aggregates are not masking inequalities within arbitrary geographic boundaries. So as the county continues to put equity at the forefront, it's important we continue to push for data disaggregated to small units of geography like census tracts, as well as disaggregated across demographics. With that in mind, I just want to focus on a couple friendly amendments, potential amendments for discussion by this body. So first of all, I just want to highlight, according to the staff report, there are approximately 175,000 renters at 80% of AMI across the county. And also, according to the county report, our unemployment is at 8% currently, with 20% of household estimated as likely in need of rental assistance given this pandemic. That would be 35,000 households. But the program, the rental assistance program is currently designed, is projected, according to the county, the staff report, to be able to meet only the needs of approximately 4,000 households. Therefore, I want to put forward a few amendments for consideration. One is currently the program is designed for 12 months. I would pivot that to 6 months initial eligibility or grant for any applicant, which would just in one fell swoop double the number of households that could be eligible or not eligible, but double the number of households that could be helped. With the recognition that if our vaccination program succeeds as outlined and planned in the staff report, our economy will be significantly open and people will be getting back to work by early or mid-July, which is 5 months from now. So the idea is move to 6 months instead of 12 months to double the number of folks households we would be able to help with this program. I also heard a number of callers mention the difficulties of being a single parent with a single income in their household. So would propose that that be included as a criteria for priority consideration. And then third, I think it would be helpful if staff could come back with a report within 30 days on what it would take to expand this program to be able to do two things. One, to include our undocumented residents and allow our undocumented residents to have access to rental assistance. And second, to ensure that the program is large enough in size to be able to meet the needs of every family and every household in San Diego that's likely going to be able to be applying or might be applying to the program. So those are my three proposed amendments. Chair Fletcher, I had a couple questions, but should I stop there, or do you want me to ask questions of staff?
Why don't we, Supervisor, address, just work through these three real quick, and then when we finish that, then you can ask questions. So if it's okay with you, Supervisor Wasserman, I'd like to ask David Estrella, as the administrator of the program, if he has any thoughts on the 12-month to 6-month component of that, and if we have any sense of what Chula Vista or City of San Diego may be doing on that.
Good morning, Supervisor. So at this point, we do not have information on the parameters of the City of San Diego or Chula Vista's program in this particular aspect. As to for our own program, we're currently administering an ERAP program that has a 2-month maximum eligibility period. So moving to a 6-month maximum criteria is certainly doable and not straying too far from our current program.
Okay. I think that makes sense. If we can do 6 months instead of 12, then we could double the number of folks with the hope that if vaccine distribution spreads up. And then there's also the possibility of additional federal help and assistance. I also have no problems with the consideration for single parents. I think we have a number of items that are in there for people to consider. And so I think that makes entire sense. One question I had on the staff report, that's just having the staff come back with a report within 30 days on what it would take to ensure rental assistance for undocumented, and then the needs to meet San Diego County. And my question, Supervisor Lawson-Remer, is that do you want staff to analyze the entire county or the unincorporated or the portion that this program is applied to? Meaning San Diego, City of San Diego has their own funding to take care of those. Chula Vista has theirs. So I just for that report back, I just want clarity so staff knows exactly what we're asking them to analyze and then bring us back a report.
So let me, I have I guess a question for staff in order to be able to answer that appropriately. My understanding is that city program for San Diego and that city program for Chula Vista are not available for undocumented residents. Is that correct?
Supervisor, I can't speak to that. They are right now in the process of finalizing their program designs. They anticipate going to their own elective bodies to finalize that, so I can't give you a definitive answer on that. I can speak to the, I'm sorry.
Okay. Then Chair Fletcher, I think it would be both, right? Since we can't anticipate, we don't know yet what San Diego is going to do and what Chula Vista would do. So I think it would be the entire county inclusive of both of those jurisdictions, and then another analysis of just the county not including those two jurisdictions because we're just not aware. We don't know yet what they're going to do.
Okay. Good. Okay, so we could ask them to analyze both. And real quick, just one calendaring item. We're asking for a report within 30 days. We have a board meeting in 2 weeks, and then we don't have an additional one after that until 45 days. So staff could either prepare a report and circulate it to offices and then present it at our board meeting, but it would be a little bit more than 30 days from now. Is that acceptable if they present it at our February, or not the first meeting in February, but the next one after that?
Again, I think this is a question for county staff. I mean, my preference would be to have this report as soon as possible and would rather have it at the next board meeting. So if it's feasible for county staff to have this report at our next board meeting, that would be significantly better for the folks who are not able to access rental assistance currently.
Supervisor, this is David. That the analysis would be contingent on items that we have no control over at this point. So if I could respectfully ask for a little bit more time to respond to your question.
Yeah, we're only 2 weeks out from our next board meeting, and they're obviously in the process of launching these programs. So we have our February 9th meeting, and then the next meeting after that, I believe is March 2nd. So maybe we could see what they could get done to update us on the progress of what we're doing at the next meeting, but then the comprehensive report back in March. Is that
perfect? Yep. Okay. Great. Thank you.
Supervisor Vargas.
Oh, sorry.
Supervisor Lawson-Remer, after we address the 3 amendments, then we'll come back for your questions on other topics. Supervisor Vargas.
I think I support the intent of the motions. I'm just a little concerned about the 6-month and 12-month, and let me tell you why. Because I don't know if the program says you can only apply 6 months for if somebody applies for 6 months. That means that they can't come back for another 6 months or no. I don't know all the details and nuances on that. And I would like to be able to really better understand what that means, number one, because a lot of folks in our communities have been without a job, with jobs for like about a year. And so them trying to get back, if you're already at the poverty level and you're getting rental assistance, trying to get back to be able to a place where you can actually afford to pay for your rent and stuff might take you a little bit more than 6 months, right? Number one. And then number two, in terms of, I didn't know that there was a single parent exclusion in this document, so I don't remember seeing that. So I just want to make sure that we're not creating something new that wasn't there. And then as to the undocumented, I probably want to urge us to really begin to have conversations with the Biden administration and our congressional delegation about making this a bigger conversation about how do we begin to ensure that resources that are coming from the federal government are able to be provided to anyone in the district without any documentation, anybody who lives in our communities. And so I want to support it, but I just think I have a lot of questions about it. And so maybe if there's a way that we can ask for a report versus just amending everything and approving it.
Can I respond for a point of clarification? So I just, to clarify to Supervisor Vargas's question, yeah, my point was not to exclude folks from applying again. You know, if they got the original 6-month grant, that they could certainly apply again, but that instead of getting a full 12 months at a time, you're getting 6 months at a time so that more people could have access in that first round. So certainly not to ensure that you couldn't, in fact, I would imagine many people might apply again. So just to clarify that, to make sure that that was not a concern. And I 100% agree. I think your point on the federal priorities, maybe we can talk about then our legislative agenda section as well. So, but just wanted to clarify that I think we're on the same page on that first point as well. Yeah.
So,
Mr. Chair, can I jump in and just make sure you understand one thing? Right at this moment, the immigration status is not a required question on the application process.
Got it. Thank you, Helen. So just to try and land the plane here on the first one. So Supervisor Lasrimir, you're basically saying instead of having a program that kind of allocates 12 months of rental assistance, because if we allocated kind of every person at 12 months, then it would limit the number of people we could allocate. I think the intent is that we aim to allocate 6 months so that we could allocate to more people. And so I think that's more of a planning purpose, which could get more people into the pipeline.
Yes.
And if it gets replenished, we could do it. And if not, we've helped more people for 6 months with the hope that things are better in 6 months' time. And so I think maybe if we added a kind of when feasible, and that the only consideration on that is this program does have the ability to reach back. And so we may have someone, to Supervisor Vargas's point, that may be 3 months behind and facing eviction. And in order to get out of that situation, we need to give them some back to catch them up and give them the 6 months moving forward. And so if we aimed for a 6 months but added a when feasible, I think that would provide the intent, but also would give the flexibility that could address Supervisor Vargas's concern. I
think that is well stated, and I support that approach.
Supervisor Vargas, is that okay with you?
Yep.
Okay, so for a friendly amendment, we have that one ticked off. The maker and seconder agree. On the second one, I think it was just under the preference. You know, we have for the new one, we have a preference for you know, local prioritization for health equity at or below 50 AMI. 1 or more individuals in the household are unemployed, have been unemployed. I think what was suggested was just adding a preference for single parents.
Correct.
And it would not exclude folks that are not there. It would just be a preference category that would be added there. Is that, Supervisor Vargas, if that's, so it's not creating or excluding, it's just adding that to our list of preferences? Okay. And then our staff report back, and then we'll go to Supervisor Anderson next for comments on these 3 amendments. Then when we finish comments on these 3 amendments, we'll go back to Supervisor Lasrimir for additional questions and then come to each of the board members beyond that. But the staff report would be assessing, I think, any changes in the federal administration, although I think as our CAO just pointed out, there's nothing that prohibits us from awarding this now, but also looking at holistically some of what we think the regional needs may be.
Correct.
And have that report back come back at our March meeting.
Thank you very much for a point of clarification. That's right. Not just an assessment of what it would mean to meet the needs of our undocumented community, but what it would need to meet the needs of everyone who is in our community who is likely to be in need of rental assistance. So we have a much clearer understanding of what the real need is and what the scale of a program might or should look like.
Okay, and is that acceptable to Vice Chair? Okay. Okay, so we now have that amendment worked in. Supervisor Anderson, if it's okay, if I can let Supervisor Lawson finish her questions, and then we will come exclusively to you and not have to bounce back and forth, and then Supervisor Desmond as well. Okay. Okay, so we have just so I can repeat for the clerk where we stand, we have a motion by myself, a second by Vice Chair Vargas to accept the 3 recommendations with the following 3 additions: that rental assistance program would strive to aim for a 6-month allocation when feasible. Number 2 would be adding to the preference category, including a preference for single parents. And 3 would be directing staff to report back at our first board meeting in March with a comprehensive look at the needs of rental assistance programs countywide, recognizing other jurisdictions have their own programs and funding, but still looking at that total and assessing the needs. All right, Supervisor Lawson-Remer, those 3 are now included in the motion. We'll let you carry on with your additional questions.
Great, I really appreciate it. So I really have one core question that wasn't addressed in the presentation in a deep way, which is to better understand what our approach is in our prisons and jails or in our county jails. I mean, we've obviously seen reports of COVID-19 outbreaks nationally, and with that concern in mind, just wanted to better understand our plan for assuring that people who work in our jails, our staff, but also who are housed in our jails, are part of the county's priority vaccination campaign.
Supervisor, is the undersheriff on the line by any chance? I don't hear anyone from the Sheriff's Department. Holly, can you address that at all, or?
Maybe we can give them a minute to see if someone can come online, and then we can come back.
Let me just make sure I understand the question. Supervisor, you're asking specifically for the vaccine rollout for the jail population, not the staff. Is that
both?
Correct?
Both.
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 Maybe Nick or Dr. Wooten could speak to where they fit.
Nick Mashone, thank you, Chair. Supervisor, we have currently, in part of Phase 1A, took care of the medical staff, the nurses and so forth, in the jail. And that was also helping them in a training program of vaccinating the vaccinators. So we've done that a number of weeks ago. As it relates to the deputies, they fall under the law enforcement officials, and at the subsequent phase, when that comes available, we would be assisting them in getting vaccinated. As it relates to those that are in the jail themselves, I'll turn to Dr. Woon.
Yes, thank you. Phase 1C covers any locations, congregate locations, aside from what's already been vaccinated in congregate settings, but particularly jails and homeless shelters where outbreak risk is great. That again is in Phase 1C. So to summarize, Phase 1A has taken care of healthcare providers and vaccinators. Phase 1B has, when we open up in February for emergency workers, police is included there, and then the actual inmates will be included in Phase 1C.
Thank you.
All right. Thank you. With that, we'll go to Supervisor Anderson.
Thank you, Chair Fletcher. As we're going through this, do we have a needs assessment on the first portion of the amendments? Because you know, when I look at this and I look at the numbers, one of my concerns is one, that San Diego and Chula Vista, if we don't know what their plan is and we get out ahead of them without understanding where they're headed, there are portions of the county that we are their only form of government. They don't have a city. So if we don't provide those services and other people are double dipping because they have their city and they have the county, I want to make sure that we're fair to everybody in San Diego County, and that those in those cities are not getting preferential treatment because we're backfilling what they're not offering already. And if we knew what they were rolling forward with, I think that would better position us to make sure that people that in unincorporated San Diego County are getting the government that they deserve from us. The second thing is when we're looking at the needs assessment, I think single income families in single families have a child care issue, but I think we should look at it holistically across the board and not limit to just those folks. When we're going through and looking at the assessment, are we looking at are we meeting the needs of everybody? I love the idea of going to 6 months because we can offer it to more people, but I think that whether you are a single parent or not, and by the way, I'm very sympathetic to it. I'm not saying that we shouldn't be addressing it, but we should look at all the assessments as far as disabilities, as far as how this has impacted everyone. And Chairman, you had talked about reach back. One of the concerns I have is a lot of these folks, as soon as we move forward, are going to be kicked out into the streets because while they lost their job and they got assistance, they may be 2 or 3 months or more behind in their rent. And I think that we have to have a holistic view moving forward. So do we have an assessment?
Yeah, one quick question, Supervisor Anderson, if I can ask David Estrella to clarify one point, and I want David to confirm this, but the money that we are receiving, the $49 million, is not money that will go to people in the city of San Diego or in the city of Chula Vista. They have their own program, and if you live in the city of San Diego, you got to apply for the city of San Diego program. If you live in the city of Chula Vista, you have to apply for the city of Chula Vista program. If you live anywhere else, that is our allocation. We're to administer that program. And so I don't think on this program there would be any double dipping. And so that would meet the needs of everyone in the county minus San Diego and Chula Vista, because that was the allocation. And so I want David to confirm that to address your concern on that. The second thing is, I think Supervisor Lawson-Remer's amendment was not limiting it to single parent homes at all. It would not be limited to them. It would just add them as a preference or prioritization along with a few of the other things that were there. And then to your third concern, I think this is a real concern if people are behind. You know, this has the ability to, when needed, potentially catch them up and then help them moving forward. But there is also an eviction moratorium in place. And I think an eviction moratorium without the availability of rental assistance creates some significant problems. And so I think the eviction moratorium and the rental assistance can help complement themselves temporarily while we get through this. But let me ask David to comment on that. And then also on the needs assessment, you know, just one thing I would point out, Supervisor Anderson, I think the need is very great. We still have about $13 million that's presently being allocated from the previous program. And those funds took a little bit to get out. But I don't think we will necessarily truly know what the regional need is, you know, because the conditions are so dynamic and changing. And so I think that the goal is to get the program out, to launch it simultaneously, hopefully with the other jurisdictions. So there's clarity that where you live, there's one program, but there's 3 jurisdictions, you know, and where you live. But let me ask David to comment on a few of those and see if those answer your questions. And then you can obviously follow up directly with him as well. David?
So yes, Supervisor, you are correct. The city of San Diego and the city of Chula Vista would be excluded from this ERAP 2021 program. They received their own funding, so there would be no double dipping in this program.
Okay, and then David, also just adding a preference would not limit it solely. It would just be a point of consideration for single parent households, but it would not in any way limit that to them.
So the regulations allow for a local jurisdiction to include prioritizations. So this would be one additional prioritization as we're filtering through and identifying cases that will be assigned, and then ultimately, if they're eligible, funded.
Thank you. Supervisor Anderson, does that address your concerns? You may have more, I think.
Well, my concern was that if we gave preferential treatment, and they didn't in those cities, but as it's explained now, I better understand it. So City of San Diego can't apply for anything beyond. So however they do theirs, that's the way it is. And I didn't understand that. I thought that we were, after they exhausted their money, then they could then turn to us.
Yeah.
Okay. That's very, very helpful. The thank you.
Thank you, Supervisor Anderson. All right, Supervisor Desmond, but you have comments on this and perhaps some other things as well. I think you're muted, Supervisor Desmond.
Yeah, you're right. Sometimes I'm better that way, but
I didn't say that now. Come on now.
no, that's okay. That's all right. I can see it though in your face. No.
No, I'm happy to hear it from you.
Hey, this is a very good discussion. I'm glad to hear, the amendments and everything else that were presented today. It's good discussion. I kind of like the idea of, doubling up if we can help more families. My only concern is that the, 6 months is not very long from now, and that's kind of where we hope to be at 70% vaccinations on July 1st. I think it's, it's great to be there, but I think it's going to take a little bit longer for our economy to come back around, particularly for those people in the lower income percentiles to get their jobs back even. So so I think there's a concern, but I think hopefully maybe we'll have some more dollars coming in before that happens. So first of all, I want to say thanks for the county for the presentation, all the hard work. It was great to see also the economics portion of the presentation as well, because we deal as we should with the health aspects of the virus. But there's also other consequences. There's other things that are happening, the economy, there's youth sports, there's businesses, there's a lot of other things that get affected by COVID. So I'm glad to hear that they were part of the discussion today. Also want to say thanks to all the hospital staffs out there in San Diego County, everybody operating in the ICUs, the ERs, the hospital beds, trying to keep, people healthy in COVID. So I know that's been trying here for the last several weeks. Hopefully it's going to get better. But just appreciate their efforts. But it has been disappointing to see the slow rollout of the vaccine from the state of California to the counties. In the Union Tribune on Sunday, they stated that California ranked last, 50 out of 50 states in the percentage of the vaccines administered to the people. However, this Sunday, I was able to go to the county's new Oceanside vaccine site. And I want to give special thanks and kudos to Ryan Clabo, Jennifer Bransford-Coons, Anita Wylia, Nick Mascione, and the entire HHS team for their great work there. I got to tell you, when it first opened up, there was 2 lines. There was a line for people with appointments, people without, and one for people without appointments. People thought, they heard it was a walk-in site, not a drive-through. So they thought walk-in meant you didn't have to have an appointment. I just wanted, Ryan, who was running that site, did a great job in explaining to people, telling them what their options were, telling them they needed appointments in a way that was very, reassuring. And even though some people left disappointed, they felt they understood the program better. So I really want to say thank you to Ryan and his team up there in North County. And I really think San Diego County is doing the best job possible with what we've been given by the state. So kudos to all our staff. In regards to yesterday's announcement, the governor allowing counties to return to the purple tier, to me, really, that was for the governor admitting that the lockdowns were ineffective and unnecessary. And I think the data really backs that up. A couple weeks ago, I spoke to a doctor at Stanford University, and he, along with other scientists, engineers, and professionals, said they did a study, looked at the countries that had the strict lockdown orders like England, France, and Germany, and compared them to other countries that remained open throughout the last 10 months, like Sweden and South Korea. And what they found was there was no clear, significant beneficial effect from stay-at-home orders and business closures as opposed to keeping those businesses open and people employed. there was no beneficial effect. And as we saw in the same editorial that was in the Sunday UT, it was mentioned that new coronavirus infections in California are occurring at among the highest rates in the world, despite the state being in the lockdowns for well over a month. So I'm glad to hear that businesses were opened up yesterday, at least a little bit. Restaurants, outdoor dining, personal care services, indoor. For many of them, though, it's too late. Many small businesses have shut their doors, laid off thousands of employees, and many of these businesses are just going to be forced to close forever. So I would like to see more businesses to be able to move indoors and operate safely. It's been nice that the governor allowed business to be open up outdoors, but we're in our rainy season, and many of these businesses just can't operate outdoors or just don't have the capacity to do that. You know, I think indoor dining could happen safely at 25%. Churches and museums should be able to operate at 25% indoors, all wearing the appropriate masks, social distancing, gloves, and everything else. I would be in favor of that today. Also, a few weeks ago, or a couple weeks ago, I met with about a dozen sports coaches who were worried about their kids. There was an article that came out yesterday in the New York Times that said a surge of student suicides pushed Las Vegas schools to reopen. Our kids are still suffering, I think, and we're failing them. We have to allow, I think, our schools to reopen. We have to allow our youth sports to resume. To me, this isn't even a question. I think it's long overdue. I just received an email yesterday from a youth sports entity, and they showed me their schedule for this weekend. They got 24 San Diego teams going to Arizona this weekend for competitions. 24 teams. That equates to about 12 kids per team and half the parents going. That's about 500 people and about 150 cars going to Arizona this weekend to compete in sports. To me, this, we should be keeping those kids here. I think it's actually safer, I think, if we let them play here. So I would like to offer a friendly amendment or friendly amendment to the motion that for the good of our kids and for their safety, both physically and mentally, that the county make it a priority and work with the state to come up with a plan to allow youth sports to resume to safe. Help our kids. Suicides are up. Drug overdoses are up. I think we must help them. So I'll just repeat it here. For the good of our kids and for their safety, both physically and mentally, that the county make it a priority and work with the state to come up with a plan to allow youth sports to resume safe competition.
So, Supervisor, just so I understand, it's basically to just have the county work with the state to come up with a safe plan consistent with state guidance and public health expert input on what it would take to reopen youth sports?
To resume safe competition with youth sports, yes.
So to have the county make it a priority to work, can we add in coordination with the state?
With the state, that's fine. To come up with a plan to allow
safe return.
Well, return to safe competition.
Okay, to allow return to safe youth sports competition.
Yeah, that's good.
Okay, I would also share with you, Supervisor, the guidance that came out yesterday from the state really does kind of lay that out. There's a number of sports activities that are allowed to resume competition in the purple tier. And so those are all allowed to begin resuming now. You'll also see the guidance that came out yesterday allows additional sports to resume in the red tier and so on and so forth. And so the state just put out that guidance that does that. But I think we can always work with the state to, in coordination with the state, to allow return to safe youth sports competitions. I think we all agree with that, working in coordination with them. But I would encourage you to really look at that guidance that came out yesterday and that plan, because there are a lot of youth sports that can have competition today. It is certainly the outdoor, lower contact type things, cross country, track and field, swimming, running, those types of entities. But there is a revised plan. on that.
understand that, but we still got teams going over to Arizona in the hundreds, you know, and people every weekend going out there. And I think it would be a lot safer if we could keep them here. So I would like to leave this as a motion, or hopefully a friendly amendment, so to make it says San Diego County is making this a priority.
Sure. I'm happy to accept that. Vice Chair Vargas?
Yes.
Okay. All right. So where we are right now, we have a motion by myself, a second by Vice Chair Vargas, to receive the update on the COVID-19 response, to ratify all actions taken in response to the local public health emergency and local emergency, 3, take any actions necessary to address the COVID-19 pandemic emergency response. 4 would be guide our rental assistance program to strive for a 6-month window of allocation when feasible. 5 would be adding a list of preference for single parents. 6 would be directing our housing staff to report back to the Board of Supervisors at our March meeting with a regional assessment of the need countywide, along with an evaluation of concerns of the undocumented, taking into account any recent actions by the Biden administration. And then 7 would be that the county would make it a priority to work in coordination with the state of California to allow a return to safe youth sports. With that, we have a motion and a second. Supervisor Anderson?
You know, I apologize for not saying this sooner, but would you be open to a friendly amendment that would assume the same operating hours as the for restaurants that the state recommendation is?
Well, that's a decision of the public health officer, because that's a part of the public health order. And so I would ask Dr. Wooten to weigh in with her thoughts on that.
What my motion would be is to follow the state recommendation.
Okay, we would need to ask Dr. Wooten for her thoughts on the present time restrictions on restaurants.
Chair Fletcher, Supervisors, this recommendation or this order was imposed before the state's order. And the rationale was to close down parties or at restaurants because we found that that was associated with an increased cases and in some cases even outbreaks. So we are continuing that. And if we get evidence to the contrary, with the actions that are taken by our residents, we will consider modifying that order. But at this time, we will keep it as is.
So Supervisor Anderson, so I wouldn't be comfortable accepting a friendly amendment to go in contradiction to our public health officer. You could offer a substitute motion encouraging the public health officer to do that. We would have a vote on that, and then we would resume operations. But I wouldn't at this point accept a friendly amendment that is in contradiction to what our public health officer feels is in the best needs of our county.
Can I do a follow-up question to Dr. Wooten?
Of course.
So she said, based on evidence moving forward, what would that look like? How would we determine it? If we're closed at 10 o'clock, how would we know to ever open other than to look to other communities who have allowed it, like Sacramento, open later in their experience? So what would that evidence look like?
Well, the action was made because we were seeing gatherings at bars after 10 p.m. Into the evenings. So that was the action, that was the evidence that caused us to impose that particular action. So as our numbers continue to go down, if we open back up, there's nothing to say that that won't happen again. And certainly now we have the compliance officers and I am certain that there probably still are restaurants that are not complying with that action. But with our compliance program, we will identify if that indeed is the case. But I am uncomfortable with the number of cases that we still have with changing that particular order at this time.
Just for clarification, you said bars, and I was talking about restaurants. So did you mean bars or did you mean restaurants? Because I think that we use different rules for those.
Well, bars and restaurants. There are some restaurants that are solely restaurants, but for those restaurants that stay open later, they basically transition into party situations. And we've seen that. We actually had to close down a restaurant in the beginning of this past summer as a result. There are multiple floors. One floor is a restaurant. The other floors was operating as a bar or a party situation. So it's really all about the number of cases. And as my presentation showed today, the number 2 location for outbreaks in community settings is restaurants and restaurants/bars.
Thank you. Chairman Fletcher, switching gears, I'd like to make an friendly amendment, if it's appropriate, to work with other cities to apply for these funds moving forward. San Diego and Chula Vista did, but it'd be great if every city applied for it so that we'd have more bites at the apple.
Which funds, Supervisor Anderson?
The CARES money that we're using.
Yeah, so Supervisor Anderson, the federal government set a threshold that jurisdictions of 200,000 or more would receive them direct. Jurisdictions under 200,000 would be consolidated into the next level of government, which here is a county. So it's not that they aren't applying for them, it's just the structure of the program.
Thank you for that clarity. Thank you.
Thank you. Okay, so we have a motion and a second on 7 recommendations. Supervisor Lawson-Remer.
Apologies. I know you're trying to get us through this. Just had a clarification to make sure that we don't need one more amendment. It's just, there was a lot of conversation, aggressive outreach to communities to ensure that people know that this rental assistance is available. So I just wanted to make sure that the plan is that the policy is going to be available in the same languages as for the Medi-Cal threshold. Just wanted clarification on that of what the language is that we're planning to do outreach in and whether that corresponds to the Medi-Cal threshold language.
Yes, David Estrella to clarify if that's our standard practice.
So Supervisor, our practice is to translate the languages into Spanish, Arabic, and Tagalog, along, of course, with our standard materials. But any adjustments that we need to make, we can, of course, include those adjustments to be in line.
Great.
Do those languages work, Supervisor Lawson-Remer? Or?
Yep, that's great. Thank you.
Okay. All right. We have a motion and a second on the 7 recommendations. I would ask the clerk to call the roll.
Thank you. Supervisor Anderson.
Aye.
Supervisor Lawson-Remer.
Aye.
Supervisor Desmond.
Aye.
Vice Chair Vargas.
Aye.
Chair Fletcher.
Fletcher, aye.
That motion passes unanimously with all supervisors being present and voting aye.
We are at 1:30. We have 7 agenda items left and then closed session. I think we will take a brief recess for lunch. Let staff and supervisors take a brief break. We will reconvene at 2 p.m. and pick up with our remaining items and then adjourn into closed session. So thank you all. We will resume at 2 p.m.